Aunque, aunque yo me digo, aunque yo me digo.
Tes 1 2 3 tes tes.
Juga semua tinggal anda nunca penuh. Berpisang, pisangku belum masak. Masalah sabigi diurung bari-bari. Mangga lepok patah kayu bengkok, bengkok dimakan api. Apinya terjurupan. Rasa sayang sayangi. Lihat dari jauh. Rasa sayang sayangi. Rasa sayangi, rasa sayang sayangi. Lihat dari jauh. Rasa sayang sayangi. Juga semua tinggal ente membuka tandukku dia. Sopong gue dulu hati sir panggil kopong sir panggil kopong. Berpisang, pisangku belum masak, masak sabigi diurung bari-bari, manggalepok, patah kayu bengkok, bengkok dimakan api, apinya cancur lupa. Sesayangi, sesayang-sayangi, lihat dari jauh, rasa sayang-sayangi, rasa sayang. Assalamualaikum warahmatullahi wabarakatuh. Good morning, Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Excellencies, honorable speakers, distinguished guests, ladies and gentlemen. Welcome to Potensia Palu Berita Hotel Banjarbaru for the second International Seminar Polytechnic of Health, Ministry of Health, Banjarmasin. Update on non-communicable diseases, prevention, control, and elevation. I am Lady Guy, and I feel honored to take part in this event as an aspect of ceremony for this incredible conference. Before we begin, allow me to distinguish Director General of Health Workforce, Ministry of Health of the Republic of Indonesia, Dr. Didi Arianti Ananda, MKM, Head of the South Kalimantan Provincial Health Service, Head of the Banjarbaru City Health Service, Head of the Banjar District Health Service, Head of Babak South Kalimantan Province, Head of PPTK LPD Banjarbaru, Director of Polytechnic of Health, Ministry of Health, Banjarmasin, Dr. Paralaki S. Director of Uni Hospital, Director of Archive Hospital, Director of Idaman Banjarbaru Hospital, Director of Radio Zaliha Martapura Hospital, Chair of Promotional Organization, IDI, YAMI, PTNI, PADELNI, Hakim, researchers, Professor Dr. Institute Latino MSc, Miss Dennis Muhammad MSc, Professor Dr. Muhammad Fadli Asmani, Miss Retno Ayu Hapsari SDZ Grade Nutrition, and Dr. Magdalena SPDFS. Distinguished faculty, fellow colleges, and honorable participants. On behalf of the organization family, we would like to extend our warmest greeting to all of you for attending and participating in this marvelous event. It's an honor for me to have you with us. Also, a huge thank you to our sponsors, organizers, and everyone who's worked tirelessly to make this event possible. Let's give them a round of applause. Before we kick off, let's quickly run through some the emergency, follow the various deadlines. Also, the first agenda is the opening, followed by national anthem of Indonesia and mass of Polytechnic of Health, Ministry of Health, Banjarmasin. Third agenda is recitation of Quran. The fourth agenda is the opening speech by our director, followed by the presentation from our keynote speaker, Dr. Arian Anaya MKM. The sixth agenda will be the presentation following the closing ceremony. Ladies and gentlemen, we are now in the opening session of the second International Seminar 2023 update of non-communicable diseases, or NCDs, prevention, elevation, and economic impact. Ladies and gentlemen, honorable attendees and speakers, in today's conference, we will the mission of the Ministry of Health, Polytechnic of Health, Banjarmasin, which is to organize community service in the health sector based on science, research results, and oriented towards community needs. Since non-communicable diseases or NCDs are the factors that the most affect of the public health, we will talk about the aspects, prevention, alleviation, and the economic impact of NCDs on the society with this webinar. So, without further ado, let's start the agenda. The first agenda is the national anthem of Indonesia, followed by mass of Polytechnic of Health, Ministry of Health, Banjarmasin. To honor our country for the national anthem of Indonesia, all honorable attendee, we kindly invite you to stand.
Honorable attendee, please be seated. For the next agenda is recitation of dua. We kindly invite Nurse Bisepta Prayogi MCAP to come forward and lead the dua recitation.
Assalamualaikum warahmatullahi wabarakatuh. Let me recite a prayer in Islamic terms. For those of other religions, please adjust. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Hamdan bihi hamdan na'imin hamdan wafi ni'mahu wa yukafu mazidah. Ya Rabbana lakal hamdu kama bagi jalal wajhikal karim wa 'azimi sultanik. Ya Allah, we thank you for your mercy, favors, and gifts because you are the reason we can be here. Ya Allah, make this international seminar as a knowledge-gathering event that will be useful for all of us now and in the future. Make the knowledge useful for us, the people around us, society, and the country. Ya Rabbana, this webinar is to obtain your blessing, so give us guidance, teaching, and direction to carry out until completion. With your blessing, we ask that you help us so that this event can run smoothly and well. Allah, make all of us present here obedient people, useful people, people who continue to devote knowledge to your path. Ya Allah, forgive our sins, the sins of our parents, the sins of our teachers, and the sins of our predecessors. Please help us to become trustworthy successors who can have a good impact on this country. Ya Allah, only to you we ask. May you always accompany us in every step forward. Subhana rabbika rabbil izzati amma yasifun. Wassalamun ala mursalin. Walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for your distinguished speakers, participant delegates, ladies and gentlemen, as our welcome greetings, we would like to present to you a traditional welcome dance, Tari Divas. This dance is performed by people dancers who bring control and graceful movement accompanied by traditional drums. These dance represent home and a reflection of the relationship between man and their God. So, ladies and gentlemen, without further delay, please join me in giving a warm welcome to our talented performance from the student of Practical Art. Thank you for your mesmerizing performance today. Our new proposition of many collaborative training. For the next agenda, I would like to invite Dr. Pailani Escandar Center MH as the Director of Politik Ministry of Health dan Informasi to give.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Best wishes to all of us. To the Honorable Director General of Health Personnel of Indonesia, Ministry of Health, Dr. Gigi Arianti Anaya, MKM, Head of the South Kalimantan Provincial Health Service, Head of the Banjarbaru City Health Service, Head of the Banjarmasin City Health Service, Head of the Banjar District Health Service, Head Bafalkes South Kalimantan Province, Head of BPTK LPP Banjarbaru, Head BRIN Banjarbaru, Director of Ulin Hospital, Director of Ansari Saleh Hospital, Director of Idaman Banjarbaru Hospital, Director of Ratu Jaleha Martapura Hospital, Chair of Professional Organization ID, IAKMI, PPNI, Hakli, Patelki, IBI, PTGMI, Persagi, as well as to all of you who are present today. First of all, let's express our gratitude to the Almighty, whose blessings are always with us so that we can all be here in a healthy state and condition. It's with immense pleasure and profound sense of pride that I stand before you today as Director of Polytechnic of Health Ministry of Health Banjarmasin to welcome you all to the second international seminar. Thank you for being with us today. It's such an honor and a great privilege to welcome you to this event. I'd like to express my sincere appreciation to the organizers of this wonderful event. In today's seminar, we are going to study, discuss, and exchange knowledge on non-communicable disease, namely chronic disease that are not transmitted from person to person with long-term progression, slow development, and rarely curable. Internally, this placing a significant burden on individuals, community, and economy resources. The main type of NCDs are cardiovascular disease, cancer, respiratory disease, and diabetes. However, it has been expanded to cover a wide range of health problems, such as liver, kidney, and digestive issue, endocrine, liver, and neurological disorders, genetic condition, trauma, mental disability condition, and disability. Therefore, prevention and control of non-communicable is a global health development priority. Non-communicable disease has caused the death of 41 million people every year, equivalent to 74% of all deaths globally. Every year, 70 million people die from non-communicable disease before the age of 70. 86% of premature deaths occur in low and middle income countries. Cardiovascular disease is the leading cause of NCD deaths, or 70 million people is followed by cancer, 9 million, chronic respiratory disease, 4.1 million, and diabetes, 2 million. The risk of non-communicable disease increase with tobacco use, lack of physical activity, harmful use of alcohol, and unhealthy diet. Several environmental risk factors also contribute to non-communicable disease. Air pollution is the most significant cause of non-communicable disease, causing 6.7 million deaths globally. A meaningful way to control non-communicable disease is to focus on reducing risk factors associated with the disease. Non-communicable disease is looming threat for the progress toward the 2030 Agenda for Sustainable Development is looming threat for the progress toward Agenda Sustainable Development. Investing in better management of non-communicable disease is critical. Management of non-communicable disease include detection, screening, and treatment of this disease, as well as providing access to palliative care for people in need. In low resources region, healthcare costs of non-communicable illness quickly deplete household financial resources. The very high cost of non-communicable disease, including treatment, which is often time-consuming and expensive, combined with lost income, plunge millions into poverty every year and hinder development. Based on previously expanded problem to broaden the public's insight, especially health practitioners, regarding non-communicable disease, the Polytechnic of Health Ministry of Health Banjarmasin is holding the second international seminar in 2023. The seminar is a form of collaboration with cross-border universities. The collaboration program aims to increase the effectiveness, efficiency, productivity, creativity, innovation, quality, and relevancy for implementing the Tridharma of higher education to improve the nation's competitiveness. Collaboration organized by university is based on the strategic plans and statute of its university. In addition, collaboration also benefit university in terms of promotion, reputation, trust, networking, and contribution to society and industry, as well as increasing student self-confidence. In establishing good relation with external parties is necessary to prioritize the principle of equality, mutual respect, and mutual benefit, consider culture, diversity, priority, national interest, and contribute to effectively and efficiently increasing the nation's competitiveness based on performance indicators. To achieve the vision and mission of the Polytechnic of Health Ministry of Health Banjarmasin, supporting activities are needed mainly to produce competent, professional, and superior health personnel. The Polytechnic of Health Ministry of Health Banjarmasin is increasing its excellence, and in order to facilitate lecture and students in the international arena. Therefore, the Polytechnic of Health Ministry of Health Banjarmasin is holding an international seminar with the theme update on non-communicable disease prevention, control, and alleviation, where there will be discussed and detection of non-communicable disease, prevention and control for non-communicable disease, treatment of non-communicable disease, and evaluation of the economic impact of non-communicable condition at the international level. The second international seminar is open to all lecturers, researchers, students, and health practitioners who wish to broaden their knowledge about non-communicable disease. The international seminar also includes participants from the Polytechnic of Health, Ministry of Health, and other universities. Both domestic and foreign, we are very honored to be able to host high educated and knowledgeable speakers for this seminar. Our estimated speakers are from Director General of Health Personnel of the Indonesia Ministry of Health, Dr. Gigi Arianti Anaya, MKM, as keynote speaker, Polytechnic of Health Ministry of Health Banjarmasin, Polytechnic of Health Ministry of Health Palangkaraya, IPB University, School of Nursing, and Allied Health Science, Santa Paul University, Philippines, Management on Science University, Malaysia. This is all I can say once again. On behalf of the seminar organizers, I would like to warmly welcome you and extend our highest appreciation and gratitude to all for attending this event. Good luck to us all. I wish you all a productive and inspiring time. To close my speech, let me do a rhyme. Saturday when a wall for a spot. Cakep. Sunday cooking, ground meat. Yeah, good. Thank you for all the support. Hope for another chance for us to meet. Waalaikumsalam warahmatullahi wabarakatuh. Namo Buddhaya, salam kebajikan.
Thank you so much for the heartwarming opening speech from our distinguished director, Dr. Parelangi Eskepners, MH. Distinguished speakers, participant delegates, ladies and gentlemen, while we're waiting for our esteemed keynote speaker, please take a moment to enjoy a moment of interlude accompanied by video of Polytechnic of Health, Ministry of Health, Banjarmasin. Thank you.
tinggal enter membuka tunjuk kuda. Serpong leko pasir, serpong leko pisang-pisangku baru masak, masalah sabigi diurung bari-bari, mangga-lepok, patah kayu pinggok dimakan api, apinya terjun panas. Rasa sayang-sayangi, lihat dari jauh, rasa sayang-sayangi, rasa sayang-sayangi, lihat dari jauh, rasa sayang-sayangi.
Ladies and gentlemen, while we're waiting for our keynote speaker, now we have to come to our main agenda, the presentation session. This presentation will be conducted in 3 sessions that will be led by our 3 capable moderators. Before commencing the first presentation session, allow me to read short bio of our moderator for this first session. Our first moderator for this session is Nurse Ruth Mauli Hutagaol, MCAP. She is graduated from a Bachelor of Nursing Science from University of Indonesia, Master in Leadership and Nursing Management from University of Indonesia. She also had many experiences as a clinical nurse in some hospital in Jakarta, and she also published some articles in both international and national reputable journal portal. Ladies and gentlemen, let us welcome our moderator, Nurse Ruth Mauli Hutagaol, MCAP, to take over and lead our session. Thank you.
Thank you, Mrs. Maggie. Is my voice clear? On Zoom, is my voice clear? Okay, thank you. I will say hello first to our speaker, Professor Derajat.
Hello, good
Good
morning.
morning, Professor Derajat.
Morning to all of you.
Okay, thank you for joining us, Professor. Glad to see you here, and hopefully we will have a lot of discussion today.
Can you hear my voice?
May we start now, Professor?
Yes, you are.
Thank you. All right. Good morning, all. Our distinguished Director of Health, Ministry Polytechnic of Health Banjarmasin, Dr. Parelangi Eskep Nurse MCAP MH. Our esteemed speakers who attend here, Professor Dr. Insinyur Derajat Martianto MSI, and also honorable participants. Thank you very much for coming to our seminar. I'm Ruth Mauli Hutagaol, and I will become moderator for the first session of second international seminar, update on non-communicable disease prevention, control, and alleviation. So, ladies and gentlemen, before the start of the presentation, I would like to inform you our rule of this seminar. The second one, the presentation will be taken by the speaker for 30 minutes and 15 minutes for discussion. Second one, question and answer session will be conducted via slido.do that will be shared on the Zoom chat room for online participants. And for on-site participants, we will give you a time to ask directly. The third one, while attending the seminar, you must keep the camera on, active, and mute the microphone unless required. And lastly, please kindly ensure that your mobile phones are in silent mode or turn off unless required. Distinguished participant, we will start this session and allow me to read a curriculum vitae of our first speaker. Team can share the curriculum vitae of our speaker. Profesor Dr. Insinyur Derajat Martianto, MSI, from IPB University, Bogor, Indonesia. He graduated from Bachelor of Community Nutrition and Family Resources from IPB University. He also mastered in Community Nutrition and Family Resources from IPB University and doctoral from University of Philippines. Currently, he is head of International Food, Nutrition, and Health Research Institute IPB until now. Vice Rector for Academic and Student Affairs from 2018 until present, and member of National Food Agency Working Group from 2006 until present. Co-director of Indonesian Food Fortification Coalition from 2021 until present. And in addition, he is researcher of CFES Center from 2005 until present. So, ladies and gentlemen, now allow me to welcome Profesor Dr. Insinyur Derajat Martianto, MSI, to present the material on global and national economic impact of non-communicable disease. So, Professor, time is yours.
Okay, thank you very much, Mrs. Moderator. Very good morning to all of you. Can I share my presentation? Can I directly share my presentation?
Clear, Professor.
Because this is unallowed to share my presentation.
Siap, maybe Komida can help the professor
So already,
to the material.
Okay, thank you very much. Very good morning to the Director of Polytechnic, Banjarmasin, to all of the speakers and audience. Thank you very much for the opportunity for me to discuss with all of you here regarding the global and national economic impact of NCDs. By education and by expertise, actually, I'm teaching food and nutrition economic, and it is usually my study is on economic laws on nutrition problems, whether micronutrient deficiencies or macronutrient deficiencies. But today, I'm requested to discuss with all of you the impact of NCDs because, and of course, this is also new actually for me. And most of my presentation is actually came from published journals, and then also from secondary data. Okay, I think all of us already know better that the definition of non-communicable diseases extended, not only consisted of chronic disease that are not transmitted person to person, that we know cardiovascular diseases, cancer, respiratory diseases, and diabetes, but now is also extended to other non-communicable diseases from liver to trauma, mental disabilities, and etc. And we noticed that there is a big impact on, of course, situation, but moreover, the NCDs also affect the economic growth of the region, of nation, of the community, and that is the one that we will discuss deeply this morning. As you know, that chronic diseases will diminish our health, and of course, furthermore, they will affect to the labor force because of the mortality, absenteeism, and disability or early retirement, and also depleted over lifetime, the lifetime expectation, of course, And all of this, of course, will diminish the economic situation through the reducing the labor productivity, higher dependency ratio, and reduce access to the factors of production, and also increase the consumption and reduce saving and investment in physical capacity. And all of the things that I have already mentioned will lower the GDP per capita, and of course, it will affect the economic growth in general. And also, for poor, it will become deepen their poverty, and of course, it will also cause the inequality. So this is how the NCDs affect our economic growth. So a very big amount of GDPs will be losses, a very big amount of income that individual or community will be losses. So that is why it's very, very much important for us to how to effectively prevent and also reduce the NCDs in our community. So usually assessment of the economic burden can be used, can use these three approach. The first one is the cost of illnesses, COI approach. And this is a very common method that sets up and capture the economic of diseases. And this will view the cost of NCDs as the sum of direct and indirect costs. And among the categories the personal medical care and also the medical costs. So that's how we calculate the cost of illnesses. And then the second is the value of loss of our output. This is the economic growth approach actually. How will we calculate this? We will estimate the projected impact of NCDs on the GDP, considering how the diseases deplete, as I mentioned before, the labor capacity, the capital factor that reduces the productive life. And the last is the value of statistical life, VSL approach. It will reflect the population willingness to pay and the rest of disability associated with disease. Of course, when we are talking about the cost of NCDs, some can be calculated in monetary term, and some others cannot be calculated. Sorry, my voices. Maaf, ini menggema ya. And then, of course, what we're talking about here is the one that can be calculated using monetary term, because non-monetary term can be very big, but sometimes we have find difficulties in how to calculate. And then, of course, the value of preventing and controlling NCDs can be plenty. We can provide more budget for the health control, and can boost our GDP, increase the workforce, etc., etc. And finally, it will also increase the earning capacity and increase life expectancy. So if we can prevent and also control the disease, so many benefits that we can go, which can be approach using monetary or monetary. Dear participant, I will later on present to you the economic impact of the NCDs. So actually, when we are looking at this data, we can see that there is a quite high increase in the cost of the CVDs, as you can see here, yeah, that the total cost of economic loss at 2010, it's only around 160 billions of US dollars, but it will increase sharply in 2030 to become more than 1,000 billions dollars. And you can see also what are the causes. You can see the many types of incidences that will cause the economic loss due to NCDs in this table. And then you can see here, there are also so many NCDs problem that will finally cause economic loss, whether they came from the medical loss, non-medical losses, or income losses. Just the amount is very, very big. Yeah. And you can see whatever the CDs type will always cause the economic loss, although it will give a different, of course, different amount of economic loss because of the different prevalence, different economic spending by both for the medical causes or non-medical causes. And then you can see here in this table, in the first table, you can see that in the 2010, this is a comparison between 2010 and 2030 data. Where we put 2030, it is related with the target of SDGs, sorry. So, you know that Indonesia is part of the low and middle income countries. And then you can see that most of the costs came from the direct cost spent by those who are affected by, and also indirect costs is also contribute significantly, but most of the costs came from direct costs. And this is also happened with the high income countries, and you can see the comparison between low and middle income and the high income countries. Is, yeah, in the low and middle income countries now it's become bigger. So in the low and middle income countries, the problem is not only the infectious diseases, not undernutrition, etc., but also non-communicable diseases become one among the pressure for the economic growth in those countries. And for the diabetes, it's also give a similar figure. Indonesia, which is part of the lower middle, also contribute very big losses, yeah, for the direct cost, the disability cost, mortality cost, etc. So then this is the trend. If you look at this figure, you can see that the economic losses due to this NCDs, like the type of the curve is, yeah, it's close to exponential. Yeah, so that's mean that now and in the future there will be a very, very fast growth of the economic loss due to the NCDs. Whatever the country type, whether it is in the high income countries or in the countries. But in the low income countries, it is the curve is still not forming exponential. But in the high income countries, it is already so that the curve will become the exponential. And then if we look at this situation in Indonesia, but unfortunately we do not have any recent data, so I'm sorry for that. So this data is from the 2012, it's 10 years ago, but I think it is still relevant to be discussed today that our cardiovascular diseases contribute the highest, yeah, in the cause of death in Indonesia. And then if you look at the right table, at the right figure, you can see that the contribution of the diseases range from the lower is diabetes and the highest is cardiovascular diseases in terms of percent economic loss that caused by the diseases. But I do not know whether the diabetes will become much more significant in the future. It can be because the growing of the diabetes is likely very fast in some time. We'll wait maybe after 2030, maybe 2030 to 2045. this figure may be a little bit shifting, yeah. But we don't know. It's all depend on the control that we will do for preventing and controlling this this kind of diseases. And this is the one that I mentioned previously from the Global Health Expenditure Database of WHO 2014. You can see this progress of the health expenditure of among the Indonesian from 95 to 2012, which is very much as I mentioned, just like a exponential curve, yeah. Of course, it is also depend not only for the prevalence of the diseases, but also the number of the population. But you can see that the health expenditure of the public and even the health expenditure of the privates increased sharply, particularly after 2000, 2000 to the year 2012. It's maybe not only double, but it is 5 times the 2012 figure compared to 2000. So very fast increase of economic losses. And if we compare the situation in Indonesia, China, and India, the same ASEAN countries, can see an interesting figure here. That, of course, it's also depend on the situation in its countries. But for cardiovascular disease, as you can see, the prevalence of the mortality of the NCDs in Indonesia is always close to China, yeah, and higher than India. But for the cancers, yeah, that the same figure is for the cancer, but not for the chronic respiratory disease. But you can see here that for the diabetes, the mortality rate in Indonesia is very much higher than that of in India and also in China. So we have to make a special note for this. And for the other NCDs, India so that the higher economic loss from Indonesia and India. And also for the communicable maternal and perinatal and also injuries. So totally Indonesia mortality is higher than India, but still lower in China because of the NCDs. And if you compare the loss of output between Indonesia, China, and India, you can see here that in China, the loss of output for cardiovascular disease, because this is in trillion US dollar, so it's depend on the number of those who are affected by NCDs. Of course, in China and India, population is much higher than Indonesia, so that's why the total amount are higher in China and in India for the cardiovascular diseases, but for the cancers, Indonesia's placed a second after China, a little bit higher than India. Then, if we look at this, this is also very much interesting figure. If we compare the economic loss output between Indonesia, India, and China in only 3 years, so you can see that the number of Indonesian economic loss is increased to 5 times compared to 2012. So that's growing very fast. So we have to make a very much we have to really careful with our situation, particularly the economic situation that affected by NCDs. So this is very much important. This information is, I think, very much important. Government that controlling NCDs is very important as well as very urgent, yeah, because otherwise our economic growth will be under very strong burden because of the NCDs. And Indonesia burden is very much higher compared to India and even China. So what type of the intervention that is provide a greater benefit than others? So from many studies, reduce tobacco use, reduce harmful use of alcohol, and reduce physical inactivity. That's mean promote sport, promote physical activity, and then reduce unhealthy diets, and how we can manage the CVDs and diabetes, and also prevent and manage cancer is all based by intervention to reduce the most of the NCDs problem. For the reduce how to reduce tobacco use, this is experience in many countries. The taxes, smalling the packaging, the package, yeah, and also warning put warning at the packaging, and then limiting the advertising, and then limiting the free public places that can that people can smoke everywhere, etc., etc. And education is among the effective way to reduce the tobacco use. And of course, tax is always tax advertising, and then limiting the availability is also very much effective to reduce the harmful use of alcohol. And education, and of course in some countries providing the facilities for to increase physical activities also among the effective way to and then of course for the unhealthy diet, yeah, there are so many things that can be used from education, and also regulation of diet, special diet for those who are affected or even not affected to prevent the NCDs are among the best intervention, etc., etc. So for those for cancer, of course, vaccination and screening, and cardiovascular diseases and diabetes, to manage them using drug therapy and regularly is a best intervention that proven several occasions. So if we compare the 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 cost between the cost and the benefit of the intervention, yeah, for the best buy package per person, you can compare here that in 2060, 2020, only 2 years after intervention, for example, the benefit is higher, much higher than the cost that is supposed to be spent by government or by individuals, and it's the benefit that's become higher, higher, and higher. So this is actually on the the cost-effective one, the cost-effective intervention using the approaches that I have already mentioned previously. So it is projected that in 2030, around $1 we spend for the intervention, and the benefit will become 13 or 15 times to the cost that we have to spend. So this is very much effective, and of course it will depend on the how effective the intervention can be done, can be managed, and can be managed. And then this is just a general figure. What is the economic of return if we spend for them to control the smoking? $1 we spend, we'll get the benefit around 7.4. And almost all of the intervention give the return at least, for example, physical activity is 2.8, the cancer is 2.7, and the highest is how to limit alcohol, particularly in the European and American countries, Western countries. It's 9.13, and then diet modification also provide a higher economic return. So I think if all of us spend this effort in this Best Buy intervention, so we can expect that we will get much more benefit and for the betterment of economic growth in our country and also for the patient. So I think the government and including us, the community, supposed to actively involve in the prevention, also the control of NCDs in Indonesia. So I think that is the one that I can share with you. Thank you very much for listening and discussing. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor, for the presentation and the material. Okay, I'm sure with such interesting ideas, there will be many curiosity from the audience. All right, we have come to this presentation. So, we will have the question already here. Maybe you can help me to share your question for the audiences. Okay, Professor, we have.
Excuse me, can you speak a little bit loudly because I cannot hear your voice?
Can you see the question, Prof, in the slide?
Yeah, okay.
Yeah. Okay.
Scale exercise.
Yeah.
It's fairly large source of state income.
Yeah, I will read it to you, Professor. The first question comes from Ibu Dr. Mela Dwi Andreastin. She is our lecturer in Health Polytechnic Banjarmasin, and the question is regarding the cigarette exercise, which is maybe regarding the cigarette exercise, which is a fairly large source of state income. Is it commensurate with the state's expenditure on medical costs caused by smoking? Please give your opinion. We allow to Professor Derajat to address the question first.
Okay, thank you very much for the question by Dr. Mela Andreastin. Well, I'm not quite sure with the question, but hopefully that my answer is meet your expectation. Of course, policy to control the cigarette smoking community in Indonesia is a choice, yeah, because you know that aside of the harmful effect of cigarettes for the health of Indonesians, the cigarette also provides a very big amount of money, taxes, and of course this is the government in what do you call in providing money, providing budget for the development as a whole. And also we understand that company and also tobacco production field are involving thousands, 100,000, and even millions of people. So this is, of course, a very important sources of income for the part of our farmers, and also for the workers in the production of cigarettes, in the distribution, in the selling of cigarettes, etc. And I think Yeah, if we look at the impact, the economic impact of the cigarette smoking, is very big in affecting our the NCDs. And of course, I'm among the one that very much agree that we have to always increase the taxes for the cigarette smoking. If we cannot stop the cigarette distribution in Indonesia, if we cannot reduce the number of smokers in Indonesia, at least we have to limit as, uh, as 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 lower as possible. And if we cannot still do that with the higher and higher tax, at least the government have to return all of the taxes from the cigarettes for the betterment of other people, because you know that the negative impact of the cigarette use is also influence those who are not smoking. So by using this budget from the taxes, we have to put mostly for betterment of the health of people. So with that, we can still protect the general people, and on the other hand, we can also put burden for those who are smoking, and also limiting the smoking. Limiting the smoking, what do you call, the cigarette selling is for in the general community, because the cigarette can be sell everyone, no, can be bought by even children can buy without any restriction. So we can increase the tax, and at the same time we can increase the control for the cigarette distribution, and at the same time return the tax for the health control of general population who are affected passively by the cigarette smoking. Hopefully, my answer is expectation Ibu Mela, ya.
Right. Thank you, Professor, for the explanation. And we have last question here from the audience. The team can share the question in the slide. Thus, we have the question and the online participant. If we doesn't have the question for online participant, maybe any of our participant who want to ask for our speaker directly. Okay. Yeah, maybe Tim can give the microphone for our audience. Okay, please to Ibu Ani give the question to our speaker. And first, don't forget to say your name and your institution, please.
Okay, thank you. My name is Ruth. My name is Anita Redel from TLM, Poltekkes Banjarmasin. I want to ask you, Prof. Dayat, from PowerPoint, we can see that in order to prevent cancer, we can screening in women from 20 from 30 to 49 years. And how much does it cost to screening? And if the screening is free, and sometimes we go to screening another place when we travel like that. How the treatment after we know the result of the screening, and how if the treatment is free or expensive. If the treatment is so expensive, maybe many people would not have the treatment because that cost so expensive and they not can afford of that. So, what's your response about that? Thank you.
Can you get the question? How?
I'm so sorry, I cannot get this question because the voice is not clear, is unclear. If you can repeat it, then it will be better.
All right. Maybe you try and repeat again.
The essence.
For slowly.
Okay. And then the warning that screening is can manage and prevent the cancer.
Yeah.
The screening is free, right? Screening is free. Then,
Mhm.
if we have the screening and we know the result, maybe it's positive or not, or maybe it's positive. And how about after the treatment? How about the cost of the treatment? Is expensive or not? Because if it's expensive, maybe the people with result positive cancer, maybe they not can afford to the treatment. That's all.
Okay, I try to answer your question, although it is still not clear for me. But you know that's why, as I mentioned before, that the economic cost of all of the NCDs, including the cancer that you have mentioned, is very high. Even for the and of course, it will be very expensive for the general people, particularly among the poor. But as you know that Indonesian government is now provide something like public insurance like BPJS, etc. So it is actually kind of a protection among the poor. They can pay little, just in a little money, but and the government will pay for the treatment in the hospital. Of course, the money is came from the uh, big, big, big amount of the community that also pay for the BPJS. But as I mentioned in this our slide that in the slides that to understand the potential problem of cancer, of course, we need a screening, and some screening is free, as you mentioned, but and then the treatment in the hospital is very much expensive, and not everyone able to pay for the treatment, of course. But that is the beautiful of the BPJS, let's say, or other insurance, health insurance is if you cannot pay, then other people will pay together with you from the money that we collect and managed by government, and then can be used for the payment for the hospital. So without any screening, we will not understand what is the risk of the cancer in the patient, and without any treatment, so it will cause a very strong that what do you call it? It's very it will increase. It will increase the mortality, and of course, the treatment is very much important. Although I also show you that actually the mortality causes by this type of NCDs is very high. But there is still opportunity for those who are affected by the any type of NCDs to continue their life, to continue and become healthy, recovery, etc. And of course it will need money to cope with. But if we are doing it together, collecting money through BPJS, through insurance, etc., we can control the health problem, the NCDs problem by using public money, and of course, the sometimes government have to subsidize these expenses fully because I cannot hear clearly your question. Hopefully, my explanation can satisfy you. Thank you very much.
Thank you, Professor, for this additional question. Hopefully, it answer your question in one. To the end of this session. Thank you very much, Professor Derajat, for the material and for your sharing. Well done from Professor Dr. Insinyur Derajat Martianto, MSI. Thanks a lot to our participants for your active participation. Please give applause for our excellent speaker and our audience. All right, Professor,
Okay, thank you very
we will
much.
give you an electronic certificate. Please stay there as our appreciation to your participation in this seminar.
Thank you.
Sorry, Professor, maybe we hope to give you a certificate because our distinguished keynote speaker already with us.
So I may
For
unmute.
that, deliver back to MC, please.
Okay.
Thank you, Ms. Ruth Mauli. Ladies and gentlemen, we have just joined by our keynote speaker. So we will hold the discussion after the presentation. To welcome our esteemed keynote speaker, I have the privilege to present a brief overview of her accomplishment. Our keynote speaker is Dr. Gigi Ariani Anaya, MKM. She is the Director General of Health Workforce Ministry of Health of the Republic of Indonesia. Now, without further ado, please join me in extending a warm welcome to our esteemed keynote speaker, Dr. Gigi Arianti Anaya, MKM. The time is yours.
Good morning. Assalamualaikum warahmatullahi wabarakatuh. Greeting to all of us. Om Swastiastu, Nama Budaya, greeting of virtue. The Honorable Director of Poltekkes Kementerian Kesehatan Banjarmasin and all the team, guest speaker, the international seminar participant attended and invited. Ladies and gentlemen, on behalf of Government of the Republic Indonesia, Ministry of Health of Republic Indonesia, I would like to extend my warm welcome to all of you for being here for the international seminar event update on the non-communicable disease prevention, alleviation, and economic impact. It is indeed momentum occasion as we can meet together and gather here to bring forth groundbreaking discussion, collaboration, and breakthrough, and also to make a strategy in the field of non-communicable disease. First of all, I would like to express my deepest thanks to all of you who are here today. Let me thank to all the distinguished participants, speaker, researcher, practitioner, and also the expert who gathered here today. I hope that your contribution in this meeting are invaluable, and that's what made this conference a resounding success. Honorable participant, the theme of this year's for the seminar in Polytechnic Banjarmasin is update on the non-communicable disease, prevention, alleviation, and also the economic impact. This event is a form of the academic activity that is a very important and very strategic for all of us, especially health workers, to increase their knowledge and also their skill in facing a global changing in the health sector, especially those related to our problem about the non-communicable disease. As we know that non-communicable disease are a disease that are not transmitted from person to person through direct or indirect contact, such as heart disease, stroke, diabetes, cancer, chronic obstructive pulmonary disease, and also the chronic kidney disease. Non-communicable diseases are the main cause of death and disability in the world, especially in low and middle income countries, and that is including Indonesia. If we are looking for the WHO data in 2020, that non-communicable disease caused around 41 million deaths worldwide, or that is equivalent with the 71% of the total deaths. And if we are looking in Indonesia, the non-communicable disease for around 73% of total death in 2018, yeah, with heart disease and stroke as the main cause. It means that we are more than the data in WHO. The non-communicable disease also have a negative impact on the quality of life, then also for the productivity and the economic growth. It is estimated that non-communicable disease will cause the global economic loss of the 7 trillion US dollar in 2011 to 2025 period. Non-communicable disease not only have an impact of the health, but also on the economic and also the development of the country. Because the non-communicable disease can cause large direct and indirect cost of the individual and also their family, the community, and the country. Direct costs include the cost of the treatment, care, and rehabilitation, because some of them need the rehabilitation, which often require a long time and need the high technology. Indirect costs include loss and of the income, the productivity, and the quality of life due to illness, disability, and premature death. Ladies and gentlemen, non-communicable disease can also hinder the country economic growth and competitiveness. They can reduce labor productivity, reduce investment, and increase fiscal burdens. For that, prevention and control of the non-communicable disease is the first priority, the top priority in the global and the national health development. The non-communicable disease can be prevented by controlling the main risk factor, namely that such as tobacco consumption, unhealthy diet, as we know now, so many variation of the food, a lack of the physical activity, and also some about the alcohol consumption. These risk factors can be influenced by various social, economic, and environment determinants such as educational, employment, income, accessibility, and the public policy. Therefore, our effort to prevent, alleviate, and mitigate the impact of the non-communicable disease are very urgent and need to be carried out comprehensive and collaborative to all participants, to all stakeholders, including government, private sector, society, and academic. We, as a Ministry of Health, cannot do by ourselves. We must working together. That's why the second international seminar at the Banjarmasin Ministry of Health Polytechnic. I think that is a good seminar, as a forum for sharing information and also experience and the latest innovation, how we dealing with the non-communicable disease. Yeah. And I encourage to everyone to active in this conference and participate in the scientific session, attend poster presentation, and network with your peer. Yeah. This is the I think this is the good opportunity to connect with like all the professional, build a collaborative partnership. Yeah. And hope that it can be continued to inspire and support your professional growth. Once again, I would like to extend my warm welcome to all the participants, speaker, researcher, student, and delegate who have attended this conference, even luring and online and offline. And I hope that we can get the fruitful discussion in this meeting. Yeah? And everybody, I hope, can share your expertise and collaborative to bring about the transformative changing that will shape the trajectory of the global healthcare. Ladies and gentlemen, finally, by saying Bismillahirrahmanirrahim, I officially declare the opening of the International Seminar event update on the non-communicable disease, prevention, alleviation, and economic impact. I hope this conference will doing smoothly and successful, and also we can get benefit from this seminar. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Shalom, Om, Santi, Santi, Shanti Om. Nama Budaya, salam sejahtera.
Thank you for the insight from our Director General of Health Workforce Ministry Health of the Republic of Indonesia, Dr. Gigi Arianti Anaya MKM. We are honored to have such a distinguished individual sharing their wisdom and expertise with us today. Okay, next, moving to our next agenda, honorable attendee, we will begin our second presentation shortly. Allow us to introduce our second moderator for the session. Our second moderator is Mrs. Tini Elin Herlina, SOSMM. Mrs. Tini Elin Herlina is currently the Secretary of Major of MLP Poltekkes Banjarmasin. She has been lecturer from 2002 until now. And before that, she has been an analyst in immunoserology laboratory of Hasan Sadikin Hospital in Bandung, West Java for over 5 years. Ladies and gentlemen, join us to welcome our moderator, Mrs. Tini Elin Herlina SOSMM, to take over and lead our session. Mrs. Tini Elin, the time and screen are yours. Thank you.
Thank you, Miki. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, all. Ladies and gentlemen, Honorable Director of Poltekkes Kemenkes Banjarmasin, Dr. Parelangi, SKep Nurse, MKep, MH, esteemed speaker Professor Muhammad Fadli, Muhammad Asmani, PhD, and Ms. Janice Florian L. Sumabat, RM, RN, MSc, Med, Pain Management. I am Tini Elin Herlina. It gives me a great pleasure to be the moderator for the second presentation session of Second International Seminar Poltekkes Banjarmasin, update on non-communicable disease, prevention, control, and alleviation. Allow me to greet the speakers for this session. Good morning, Ms. Janice. Can you hear me? Okay. Professor Fadli, Assalamualaikum. Bisa mendengar suara saya, Profesor Fadli? Can you hear my voice? Okay, thank you. How are you, Professor and Miss Janice? Okay, I hope my voice is clear then. Okay, that's great. I hope you enjoy your time there, and thank you for spare your time to present this occasion. Ladies and gentlemen, before we start the session, I'm going to tell you how this second session will run. The session will run for about 30 minutes, including the question and answer. But for the first time, maybe we are going to Professor to present at the first time. Okay, for the first speaker in this session, please join me to welcome Professor Dr. Muhammad Fadli Muhammad Asmani from Management and Science University MSU, Malaysia. He is currently the Dean School of Pharmacy Management Science University, Malaysia, and he completed PhD program with Yosei University, Japan, in the area of transdermal hair follicle skin permeation pathway. His project was related to the skin permeation pathway for acne tropical formulation, and he is also active in halal cosmetic research and in practice for 15 years. With no further, now allow me to welcome Professor Fadli from Malaysia to present the material on Malaysia's strategic plan on NCDs. Professor Fadli, time and screen is yours. Sorry, Prof, we can't hear your voice. Sorry, Professor, we still can't hear your voice. Maybe the computer can help him. We still didn't hear your voice, Professor. Okay, Professor. Yeah, we still can't hear you. No.
I apologize, Professor. There seems to be a problem with the audio. As of now, we still cannot hear your voice. Sir, you're still muted. Would you like to turn on the to unmute? I apologize, Professor is still muted. Once again, would you mind to unmute?
It's still mute, Professor. The committee, can you help me? Maybe it's mute from us. Okay, it's not unmute now. Committee, excuse me, we still mute the professor. Can you help me? Okay, Prof. But unfortunately, we still can't hear you. Oh, okay. Excuse me. Can you help me to unmute for both number of Mr. Professor Fadli? There is two number. Unmute both of. Which name is Fadli Asmani Ma'am. Okay. Unmute. Both of.
Hello, can you hear me? Hello? Can you hear me?
You can
Okay, I
start
can speak
now.
right now, right? Thank you very much. Very sorry for the technical issue. Can I share my slides straight away since I think we are behind the time, behind the schedule? Is it okay? I share. Oh, disable. Can anyone enable my screen sharing? Is it okay?
Yes, we can see it.
I can share. Huh? All right. Thank you very much. All right. All right. Is it clear my slide?
Yes, sir.
Okay. All right, thank you very much. Very sorry for the technical issue. First of all, I would like to say thank you very much for the invitations. Salam hormat dari MSU, dua negara serumpun yang dihormati Dr. Gigi Arianti Anaya, Director General of Health Personnel of the Indonesia, Ministry of Health Indonesia, Dr. Parlangi, Director Polytechnic of Health Ministry of Health Banjarmasin, committee members, kesyukuran, panjang syukur kepada Hadrat Ilahi. Thank you very much for inviting me. Banjarmasin is very close to my heart because I think if it's not, maybe I would like to share. Actually, originally myself, saya adalah keturunan Banjar from Banjarmasin. I'm not very sure which part, but my late father told me he is coming from Banjarnegara, and my mom is from Banjar Alai. I do not know which part, but I wish I will able to visit Banjarmasin at the near future. So Banjarmasin is very very close to my heart because is related to my relative and so on. Okay. First of all, once again, I would like to say thank you very much on behalf of MSU and School of Pharmacy. And I feel very grateful get the invitation to join this very grand, very distinguished, very, I think, timely to have this kind of seminar related to international update of non-communicable disease. So I would like to start with this introductions NCD in Malaysia. This is related to last year announcement from the ex-Ministry of Health Malaysia during the COVID times. So they mentions that Malaysia will align its national strategic plan for non-communicable disease with the WHO, and it is very important in preventing and controlling NCD. We need all the encompassing approach at the national and sub-national level with multi-stakeholder. So the Ministry of Malaysia at that time realizing the preventing and controlling NCD is very, very important for Malaysia. So the second announcement also from the press, Malaysia will look into the national health screening initiative, particularly by using the digital apps or mobile apps in order to combat non-communicable disease in Malaysia. I think these two statements from the ex-Ministry of Health at that time is very, very timely, very, very important to all of us, particularly for the Malaysian. And recently, the current Ministry of Health in Malaysia mentioned, it's announced it that almost 20% of Malaysian adults have diabetes by Dr. Zaliha, Ministry of Health. And it says that it's very important to have a various measure will carry out to tackle diabetes prevalence, including the National Strategic Plan for Non-Communicable Disease, Health Advocacy Program, and Health Screening. So this is introduction from us from Malaysia to indicate that it's very important for us to look into the program, the strategies, how to control the non-communicable disease because the impact is bad for the countries and for us as well. So with that, allow me to present the Malaysian Perspective National Strategic Plan for Non-Communicable Disease was planned for the year of 2016 until 2025. We're using these guidelines how to manage with the non-communicable disease in Malaysia. Okay. As an introduction, everybody knows that non-communicable disease is particularly related to the cardiovascular disease, cancer, chronic respiratory disease, diabetes, and so on. And we noticed that 63% globally death related to NCDs, and 90% is related to the premature death from NCDs, which is particularly at the low or middle income countries, and most premature deaths are linked to the common risks, namely tobacco, unhealthy diet, physical activity, harmful use of alcohol. Based on this, I think we planned, set the strategies how to deal with all this issue. Okay, in Malaysia, we noticed that the lifestyle change has been parallel with the rapid rise in the numbers of Malaysians suffering from non-communicable disease, NCD. And according to the National Health of Mobility Survey, 1 in every 5 adults in Malaysia was diagnosed with diabetes. You see, every 5, 1 diagnosed with diabetes. 3 in 10 people with hypertension, and 4 in every 10 people were diagnosed with a high cholesterol. That is the major one. Diabetes, 1 of 5, hypertension, 3 of 10, and cholesterol is 4 of 10. So it's a very serious issue, and I think Malaysians have to look into this, and particularly recently also we are the highest numbers in Asia, South of Asia. Malaysia is the highest numbers of diabetic cases. So it's very alarming for Malaysian. So therefore, Malaysians have developed integrated NCD strategic plan, mainly on the topic of active living, nutrition, cancer control, tobacco control, alcohol control, salt reduction, obesity control, and so on. All of this thing is penned down into the NCD 2016-2025. The key focus for the ministry is transform patient care by expanding promotion and disease prevention as part of renewal focus on NCD management. To support this initiative, this is a need for more advanced diagnostic and imaging medical device for hospital and self-monitoring device for individual. Currently, focus on self-monitoring device, I think, actively in Malaysia. All right. So, okay. The strategic plans in Malaysia, we are focused on NCD cardiovascular disease, NCD diabetes, NCD cancer. That is the major part. And we also look into the risk factor, which is tobacco, unhealthy diet, physical activity, and harmful use of alcohol. So this is, we try to align with the plan of to combat the cardiovascular disease, diabetes, and cancer. We match with the risk factor, which is tobacco use, unhealthy diet, physical activity, and harmful use of alcohol. That is the framework. That is the concepts, the principle of NCD in Malaysia, which is related to the national strategic plan. Okay. The main objective, the 5 main objective, is strengthen the national capacity, leadership, governance, multi-sectoral actions, and partnership. That is number 1. Number 2, we reduce the morbidity risk factor. Number 3, we strengthen the Orient health system. Number 4, we promote and support national capacity for the high quality research and developments. Number 5, we monitor the trend and determines of NCD and evaluate the program. There is a 5 main objective in our plan. Okay. If you look at the burden of NCD in Malaysia, here we notice for the male, high BP is number 1, tobacco use number 2, number 3 is diabetes, and number 4 is BMI, obesity, and number 5 is cholesterol. If you look at the female in Malaysia, it's a similar, except tobacco will not be in the list for the female. So that is, we identify the burden of NCD in Malaysia. And this is our, we notice also the trend will be increasing. It shows they're very increasing and very, very alarming for Malaysia. We look at the risk factors, diabetes will increasing every year from 2006 to 2011 and 2015. Same goes to the cholesterol, hypertension, and so on. So that is the background of a problem. And if you look at this budget, impact on society and government budget is very big. We have to spend almost 3.52 billion in a year to come back to tackle of this issue. So it's bad impact. And if you look at the NCD risk factor for the 10 ASEAN countries, Malaysia will be number 1. So very sad to share all this finding and report. So therefore, from all these issues and report, Malaysian strategic plan are related to life course approach. There is a strategy we plan. We look into the intervention in early life often offer the best chance for primary prevention. So meaning that we focus on the intervention of prevention. We also look into the maternal health, including preconceptions. We look into the antenatal and postnatal care, maternal nutrition, and reducing environmental exposure to the risk of the NCD. So that is the factors. Of course, we try to improve our NCD cases in Malaysia by concept of life course approach. Okay, we also try to empowerment of the people and the communities. This is our plan, second plan, which is all the activities involve everybody. And this one is related to the prevention and the control. So including the policy, planning, legislation, provisions, service provision, monitoring, and so on, we are empowerment of peoples and communities. So that is a second approach, we using it. And number 3, of course, whatever we plan, we have to look into the strategized program and activity for the prevention and control of NCD. And all these things are related to the evidence-based strategy. Number 4 is multi-sectoral actions, which is effectively NCD prevention and control require leadership, coordinated multi-stakeholder engagement will help both at government level and at the level of wide range of stakeholders. So now in Malaysia, quite popular with the concept of private and public partnership. Whatever we do, planning to treat NCD or planning to prevent the NCD, the concept of private and public partnership will be implemented. The government will focus the collaborative approach within the private sector and the public sector. That is number 4. And that is our target. In Malaysia, we target by the year 2025, hopefully our risk of premature mortality will reduce to 15%. Tobacco use will be reduced by 15%. Population intake of sodium, 6 grams per day, per year. And insufficient physical activity, also 30%. Hopefully, all the Malaysians will be more active. Harmful use of alcohol by less than 1.2%. Prevalence of raised blood pressure 26%, and prevalence of diabetes and obesity is less than 50%. This is our target. Hopefully, will be achieved. But when we look at the projections of the diabetes in Malaysia, is very alarming for us. They're not very good. So therefore, we try to operationalize our plan, national strategic plan, by using a few split guideline, split plan, but will be aligned to all the objective and the risk factor just now you mentioned, which is we plan for tobacco control, we plan for combat obesity, we plan for the salt reductions, we plan for the active living, we plan for alcohol control, and we plan for the cancer. So and last, we also strengthening the chronic disease management and primary care level through enhanced primary health care. Number 7, I would like to emphasize here that is enhanced primary health care related to the preventions of the NCD. I think is more useful in Malaysia. So related to that, there is an example or summary of the action plan and initiative of the National Strategic Plan for Combat NCD in Malaysia. Number 1 is we plan to tobacco control, and we call it as the end game, or GEG, Generations End Game. We focus for the citizens who are born in January 2007 should not have addiction to tobacco. And we aim, or the generation who are born from 2007 will not involve with smoking anymore. So this is our objective. So many plan, all the universities and so on now promoting to have cessations of smoking. In School of Pharmacy, we do have a Bengkel, we do have a plan related to the health screening and so on. So we focus on the GEG, this generation and game. So we hope the generation who are born by 2007 will not involve in the tobacco. This is our aim. And number 2, we also try to combat the obesity, a call for immediate action to combat obesity in Malaysia. Various school, higher learning, and so on is involved in these plans. Now, I think in Malaysia, many programs introduced by the institutions, including MSU, for example. We are promoting the diet, healthy diet to combat the obesity. I think maybe we will heard now they are saying that is something wrong with our pyramids of nutrition. Those who are dietitian or nutritionists will understand that. But I dare not to say about that. But in Malaysia now, I would like to share is quite common people talking about the diet, which is a less carbohydrate and high fat. So, which is a contradict a bit with the common nutrition pyramid, which is people talking bad about fat, but now people say the fat is very important to reduce the intake of carbohydrate and gluten, because the fat can replace the sugar to provide the energy. So it's related to intermittent of fasting. When we fasting, so meaning that we are very hungry and then we need energy. So by taking fat, that is the source of energy, rather than taking carbohydrate and glucose as a source of energy. So there is a concept of prevention of obesity by introducing the what we call it, the low carbohydrate and high fats, or ketogenic diet and so on. So it's been debating this plan. But anyway, Malaysian still works very hard to combat the obesity in Malaysia. Okay, same another strategy is we control the salts intakes. We hoping that we target only 6 grams per day taking salt by the citizen in Malaysia. This is our target. And then active living, yes, we want our citizen in Malaysia actively creating the healthy and active community. We support the active living, support the appropriate environment for the active living. We motivation the publics through the public education, behavior change, partnership collaboration, and so on to make sure that our society are active, tidak duduk rumah dan tidur saja. We are involved in the community activity as well. So same goes to alcohol. We are campaign healthy without alcohol. That is one of the strategic in our national strategic plan to combat the NCD. Okay, strategic plan number 6 is cancer control. Yes, primary prevention, screening, early detection, diagnosis, treatment, rehabilitation, palliative care, and as well now getting popular by using the traditional and complementary medicine, TNCM, is a part of controlling cancer in Malaysia. For MSU, Management and Science University, we do have a program. We collaborate with the China, which is Henan University, Traditional Chinese Medicine, Henan University. We are really focused in research of developing medicine to treat cancer by using the herb or traditional Chinese herb. And also, we promote the integration of hospital by using the allopathy approach and also TNCM, traditional and complementary medicines, to treat the cancer and also as well to the other diseases. So in Malaysia, for example, in MSU, and we do have a MSU medical center, and in MSU medical center, we do have a clinics, and the consultant and the practitioner of TCM will work together to treat and to promote the use of TNCM to prevent the cancer. So there is a part of strategy. And strengthening the chronic disease management at primary care, yes. There is, I think, pharmacy for us also involved actively, make sure the level of enhanced primary health care actively promoting successfully in Malaysia. So we believe with the 6 major interlinked component, population enrollment, risk profiling, and so on, will be improve the healthy lifestyle in Malaysia, and as well improve the preventions of the NCD. Okay. If you look at the campaign from Malaysia, we call it Empowering Malaysian Through the Community Sihat Pembina Negara, COSPAN. And this is one of the campaign, I think is really successfully. In this campaign, introduced by the government, promote the healthy diet, active living, smoke-free, weight management, routine community NCD risk factor and screening. So that is very useful for Malaysians through this campaign, through this activity, integrated activity under the COSPAN, Komiti Sihat Perkasa Negara, will improve the NCD in Malaysia. So it's a very good strategy by using integrated involvement of Malaysian people under 5 main scope, which is healthy diet, active living, smoke-free, weight management, and routine community NCD risk factor screening, will overcome the issue of NCD, particularly for diabetes, hypertension, hyperlipidemia, cancer, and cardiovascular disease. So that is another thing. But never forget about the monitoring and evaluation. Whatever you plan, we have to monitor and we have to evaluate either it's success or not. So therefore, we have to introduce the interagency training committee for the health promoting environment and healthy lifestyle. And also we use the interagency technical committee for health promoting environment and healthy, which is related to health screening. And we do have a committee to monitor and evaluate whatever we plan successfully or not. So never forget about this is our target. We always mention when I have a meeting, we always look into the indicator and target either we achieve or not. And overview for the non-communicable disease surveillance in Malaysia at the moment should be strengthened. We have to be strengthened and integrated into the existing national health information system, including the NCD civilian frameworks. We look into the monitoring and civilians, and also we have to identify the significant acceleration in financial and technical support for this non-communicable disease in Malaysia. So discussion moving forward, the adoption of electronic health record, this will improve our monitoring and evaluations. And database of healthcare is very important for us to make the right decisions and the right plan in the future. Yeah. Okay. I would like to take this opportunity to look into this article, this journal. I think is worth to consider, which is the process evaluation and enhancing primary health care for non-communicable disease in Malaysia is very useful to the country, which is actually very simple. They promote the component of namely as a deployment of primary and secondary triage sub-counter. Maybe we notice when we go to the big hospital, there is a triage counter, which is there, look into the BP, NCD screening, and so on. But we love to implement the same thing to the community clinic as well. So we should have a triage to look into all these components, and therefore we can get data, the complete data, and we can use the strategic plan or the strategic action plan to overcome the NCD in Malaysia. So to summarize that, we would like to introduce the triage counter at even a small clinic. All right, that is the deployment of triage counter. So which is the primary triage counter aim to effectively channel the direct patient according to the case, designation, lifestyle training, and so on. And the secondary triage counter aim to screen the detect undiagnosed NCD case and ensure care continuity for ongoing NCD cases. So that is important, the objective why we introduced the triage counter. And we also introduced the coordinator, we call it a care coordinator, to facilitate and coordinate NCD care related activity in Malaysia. And also we introduced the NCD screening as well at the primary healthcare. So the NCD screening is not necessary in the big hospital. NCD screening, we would like to implement it in even the small clinics, in even a rural area. So that is the we plan to do. And NCD risk management as well, and also including the referral system. By using the digital referral system, we call it the Integrated Specialized Service ISS, in-house or visiting allied health professional will be important. So in this referral system, we include nutritionists, physiotherapists, pharmacists, and so on to combat NCD in Malaysia. So conclusion, enhancements of primary healthcare is very important and will be shows as actively effective to treat NCD in Malaysia. So one of the example, I think been run now, which is for the pharmacy side, we introduce the medication therapy at Hadron Clinic. For example, we have a diabetes medication therapy at Hadron Clinic. We do also have, like, say, some sort like diabetes, respiratory, and so on. All the different clinic focus to the disease. including the hypertension therapy adherent clinic as well. So based on the study, survey and so on, is a proof that the medication therapy at the clinics is really helpful. Make it less burden for the doctors. And because when the doctors prescribe and doctors treat, doctors diagnose, they will pass to the pharmacies. Pharmacies will take care the patients related to NCD to make sure that compliance, the effectiveness of medication is managed by the pharmacies. So pharmacies will be lead this clinic. We call it medication therapy adherent clinic. Actually is led by pharmacies and is, I think, really useful. And the objective of this medication therapy adherent clinic is to improve patient knowledge, to increase patient adherence, to reduce adverse effect, to educate patient about diabetes complication. For example, this is a adherent clinic for diabetes, and assist physician in monitoring patient drug therapy and medical condition. So this is one of the enhancement primary care clinic introduced by pharmacist team. We call it medication therapy adherent clinic in order to reduce the NCD cases in Malaysia. So this is a scope of service. Pharmacists will perform duty including assessing patients of pharmaceutical care issue, documenting action plan, and provide appropriate education to the patient and so on. So this is a scope, and this is what we do as a pharmacist to help the NCD cases in Malaysia. Actually, we look into the identifying pharmaceutical care issue, we solve the pharmaceutical care issue, and we do the drug therapy monitoring, and also we recommend any interventions in order to increase the quality lifestyle of the patients, and as well to reduce the NCD in Malaysia. So this is a medication dispensing all done by pharmacies, and all the relevant data will be recorded for the further actions and later on. Conclusions, most of the premature deaths due to non-communicable disease are largely preventable actually. So that's why we have to tackle the shared risk factor. Just now, we mentioned the tobacco, unhealthy diet, physical activity, harmful use of alcohol. We have to tackle all this issue. And essentials, civilian component must be there, and the roadmap or the relevant stakeholder, empowerments of the committee and so on have to be included, and multi-sectoral collaboration, some sort of public and private collaborations must be included, and also population will reach the highest attainable standard of healthy and productivity at every age, and NCD are no longer a barrier to our well-being. So that is a conclusion from me. And once again, I would like to thank you to all the committee members, and thank you very much to inviting me to share the National Strategic Plan of NCD on behalf of Malaysia. Thank you very much. Back to you, Ms. Chairman.
Okay, thank you, Professor, for the presentation. According to information that you still have an activity to attend, is that okay if we have to answer one question, Prof?
Yeah, come again. I cannot hear.
Because there is one question for you.
Okay, this question. Okay.
Okay, I'm going to read it. It comes from Rizky, student from Poltekkes Banjarmasin.
All right. Okay.
Yeah. NCD usually infect people from low to middle income economic background. They are able to get medical treatment due to economic limitation. So what is the strategy? Maybe strategy to help people with low middle economic background.
Okay. All right. Okay. Understand the question. The question actually is how we going to overcome the issue to treat NCD for the family who are coming from the low to middle income. Am I right? That is the question. Okay. All right. In Malaysia, I would like to say that the Malaysians the government now almost support the medical treatment is, I can say that relatively is 100% by government, backed by the government. For example, if I'm would like to seek the treatment to the government clinics, I only pay RM1 Malaysia. And I will bring back all the medications is, I think the value is maybe related to RM100 Malaysia. We are lucky. We have a government, very strong government who are support to make sure that the kebajikan kesihatan for Malaysians is being take care. And at the moment, I think most of the people in Malaysia are able to reach the health facilities easily. And for in Malaysia, we are focused to increase the compliance of the medications. So we notice public in Malaysia easily get the medication, easily get treatment, but they are not really comply to the medication. Therefore, the NCD cases still high in Malaysia. And furthermore, the lifestyle is also not that right. So the NCD cases in Malaysia is high. So at the moment, to answer your question, for Malaysia, yes, they are provide the almost full facilities for the all income, regardless whether you are higher level income or low middle income, Malaysian people able to get the facilities in Malaysia. But under the plans, we also include the public private partnership, because we notice there is a queue to get a treatment from the government, which is almost free for Malaysian, but many people try to get the treatment, so therefore the queue is long, so they have to wait long. That's why Malaysian government now promoting the public-private partnership, whereby the patient who are really need urgent treatment, they can go to the private hospital and get the treatment in the private hospital, but the cost will be borne by public and private as well. There is a collaborative work. So this is a strategy how government to tackle the issue. We supply the health facilities, health treatment to the all group of people in Malaysia, plus make sure that we get the fast treatment. So by public and private, we able to get the fast treatment for emergency cases. So I hope can answer your questions.
Cooperation is very important, right? Okay.
All right.
Okay, then. Thank you so much for Professor for your responding. I believe you still have another activities, so we appreciate your time here, and you may leave the room, Professor. Thank you so much.
Thank you very much. Thank you.
Okay, ladies and gentlemen, we are going to continue our session with Miss Janice. Miss Janice, are you still there? It's still unmute. Yeah, it's still unmute. Yeah. Thank you for waiting. I'm so sorry because Professor have to go to another activities, I think. Okay.
No problem with it.
Is
No
it-
worries.
Yeah. Is that okay if we start now?
Sure.
Okay. Thank you. Okay.
Do Do I share my screen now or?
Yeah. Not yet. I'm going to read your CV first. Okay, this is participant. We will commence our second session presentation. Allow me to read a brief intro to our second speaker. Our second speaker is Miss Jani Sumaba from School of Nursing and Allied Health Science, St. Paul University, Philippines. She was graduated from Faculty of Medicine and Surgery from University of Santo Tomas, Philippines. She has a lot of speaking engagement from 2007 until now and enrolled a lot of postgraduate training. And she has specialized in pain management. Okay, Miss Janice, time and screen is yours.
All right. Salamat pagi.
Selamat pagi, Miss Janice.
Well, I'm very much thankful for being given this opportunity to share with you a bit of my knowledge on non-communicable diseases. And discussing this topic is actually new to me since my expertise involves pain management. However, today I was tasked to discuss prevention and control of NCDs. So let's start. Okay, I have no conflicts of interest to disclose. Okay, non-communicable diseases account for a large and increasing burden of disease worldwide. So let's discuss global statistics. Data from WHO on September 2023 shows that 41 million people are killed each year due to NCDs, equivalent to 74% of all deaths globally. And each year, 17 million people die from NCD before age 70. And of all the deaths, or of all NCD deaths, 77% are in low and middle income countries. Cardiovascular diseases account for most NCD deaths, or 17.9 million annually, followed by cancers, which is 9.3 million, chronic respiratory diseases, 4.1 million, and diabetes, 2 million, including kidney disease deaths caused by disease. These four groups of disease account for over 80% of all premature NCD deaths. Now, let's take a look at the statistics here in the Philippines. According to the data compiled by the Philippine Statistics Authority from January to June 2021, the top 5 causes of deaths in the country are ischemic heart disease, cerebrovascular disease, including strokes and aneurysms, neoplasms or cancers, and COVID-19. And a recent report from the WHO also shows that an estimated 70% of deaths in the Philippines are due to non-communicable diseases. 511,748 Filipinos succumbed to non-communicable diseases in 2019, 72% of deaths among women, and 68% of deaths among men.
Excuse me, Miss Janice.
Yes.
The screen is still on the first.
Oh, really?
It's not moving. It's still number 1. Okay. Yes. Okay, we can see that.
Okay. Okay, so as I was saying, 511,748 Filipinos succumbed to NCDs in 2019, 72% of deaths among women and 68% of deaths among men. The report also shows significant figures on the number of fatalities in 2019 due to NCDs. 34% were cardiovascular-related diseases, 24% were communicable, maternal, perinatal, and nutritional conditions. 13% were due to other NCDs, 9% were cancer-induced, and the remaining percentages were chronic respiratory diseases, diabetes, and injuries combined. So in Indonesia, this is what I found the data according to the WHO in 2018. NCD country profile, the proportional mortality in Indonesia were cardiovascular diseases. That makes 35%. Cancers, 12%. Chronic respiratory diseases make up about 6%, as well as diabetes mellitus. Injuries, which is also 6%, and other NCDs, 15%, and communicable maternal, perinatal, and nutritional conditions at 21%. So what are non-communicable diseases? And NCDs are a large group of diseases which are by definition not communicable from one person to another. They are also called chronic diseases because they are usually long-lasting and progress slowly. They occur as a result of a complex interaction of genetic, physiological, behavioral, and environmental factors. Non-communicable diseases are very broad and diverse group of diseases and are of many different types. So the four main types that are responsible for over 80% of all deaths are cardiovascular disease, such as heart attacks and strokes, cancers, chronic respiratory diseases, such as COPD and asthma, and diabetes. Others include mental health disorders, chronic kidney disease, musculoskeletal disease, and sensory disorders such as eye disease or hearing loss. Some of these, such as cardiovascular diseases, are large contributors to death, and others, such as mental health disorders, can have significant health effects to the disability they cause. NCDs are a major problem all over the world and are responsible for about 41 million deaths a year, and this is about 74% of all deaths. Most of these are in low and middle income countries. In addition to this, they cause considerable disability as well. They have a significant economic impact to the healthcare and medication cost. And because they limit a person's ability to work, countries spend a significant proportion of their healthcare budgets on these diseases. And the problem is only going to get worse. It's estimated that by 2030, deaths from NCDs will increase to 52 million a year. This is due to a number of reasons, such as population growth, a rise in the aging population, globalization, urbanization, and changes in behavioral, occupational, environmental risk factors. So, who are affected by NCDs? So these diseases can affect some groups of people more than others and in different ways. All age groups, even childhood, can be affected by these diseases. For example, genetic diseases and some cancers can have an impact from early childhood. However, NCDs are generally more common in the elderly. This is because the risk factors accumulate over time, and the elderly tend to have coexisting diseases and weakened immune systems. There is an inverse relation between socioeconomic status and NCDs. People with low socioeconomic status are at a higher risk of dying from these diseases and tend to have more risk factors compared to those with high socioeconomic status. NCDs and poverty are also closely interrelated in a vicious cycle. Poverty can lead to NCDs or can lead to increased rate of NCDs, and these diseases can drive people into poverty. Now, let's take a look at some of the risk factors for non-communicable diseases. There are many risk factors that contribute to the development of NCDs. And
Excuse me, Janice,
yes,
it's not moving again.
is that again? Oh,
For
for slide only.
page 4. Maybe you can try the slide so.
Okay. Where did I stop? Which slide did I stop?
From the risk factor, I mean.
Risk factors. Okay.
But we can we still can see it. Yes. It is in risk factor.
Okay.
Okay, you can continue.
So let's take a look at some of the risk factors for non-communicable diseases. There are many risk factors that contribute to the NCDs, and these can vary depending on the disease. But broadly speaking, there are two types of risk factors, and these are non-modifiable and the modifiable. Non-modifiable risk factors are those that can't be changed by an individual. These include age, sex, and genetic makeup. Modifiable risk, on the other hand, or modifiable risk factors, on the other hand, are risk factors that can be changed by a person. So there are four important modifiable risk factors. These are smoking, physical inactivity, poor nutrition, and the harmful use of alcohol. It is important to note that the exposure to risk factors can happen over a person's lifetime. Okay. Or, I'm sorry, these risk factors could lead to or worsen metabolic risk factors such as high blood pressure. Wait, where is my... I'm sorry. I think I lost my...
Any problem with the screen, please?
I'm sorry. Can I just... I'm sorry for. Okay. These behavioral risk factors to continue could lead to or worsen metabolic risk factors such as high blood pressure, high blood lipids, increased glucose, and obesity. It is important to note that the exposure to risk factors can happen over a person's lifetime. It could be during childhood, adolescence, adulthood, midlife, or even before birth. So during a person's lifetime, there are critical periods of growth and development when risk factors can do more damage than they can do at other times. And different risk factors can gradually, I'm sorry. Okay. And different risk factors can gradually accumulate over the life course and cause an impact in later life. Generally, the more risk factors a person is exposed to, the higher likelihood there is of developing a disease. Okay, so let's briefly discuss the 4 key diseases. The first one is the cardiovascular disease. CVDs are the leading contributors of the global burden of disease among NCDs and account for the most deaths worldwide each year, even more than the number of deaths from cancer and chronic respiratory diseases combined. CVDs are a group of disorders that are not only related to heart conditions such as ischemic heart disease, stroke, congenital heart disease, coronary heart disease, cerebrovascular disease, peripheral arterial disease, and rheumatic heart disease, but also to blood vessels that involve hypertension and conditions associated with cerebral, carotid, and peripheral circulation. So according to the American Heart Association, there are 7 key health factors and behaviors that contribute to the increasing risks of heart disease and stroke. So these are nutrition, smoking, overweight or obesity, physical inactivity, uncontrolled blood pressure, elevated levels of cholesterol and blood sugar. And most CVTs can be prevented by addressing the 7 risk factors, which involves healthy diets, regular physical activity, avoiding smoking and secondhand smoking, reaching and maintaining a healthy weight, and keeping blood pressure, cholesterol, and blood sugar levels under control. Okay, the second is the cancer. Cancer is the main public health problem and the second main cause of death globally. The causes of cancer can be classified into 3 categories, including biological carcinogens, which are viral, bacterial, parasites, infections, hormonal, and genetic factors. Chemical carcinogens, these are the food and water contamination and tobacco smoking. And physical carcinogens, ultraviolet and ionizing radiation. So according to the report of the WHO in 2018, the most common cancers are lung, breast, colorectal, prostate, skin, and stomach, while the most cancer deaths or deaths coming from cancer are from cancer of the lung, colorectal, stomach, liver, and breast. We go now to the chronic respiratory diseases. CRDs cover a wide range of diseases in the airways and the other structures of the lungs. Most of the morbidity and mortality of CRDs is increased with age. CRDs include chronic obstructive pulmonary disease, occupational lung disease, asthma and respiratory allergies, sleep apnea, and pulmonary hypertension. So genetic and environmental factors are the risk factors of CRDs. Environmental factors such as air pollution, including tobacco smoke and secondhand tobacco smoke, indoor and outdoor air pollution, occupational exposures, and socioeconomic factors are the dominant factors that come from environment. All right, and then here comes diabetes. Diabetes has attracted global attention due to its elevating prevalence and incidence. It is not only chronic disease, but also an acutely life-threatening condition. Further, it may cause other serious diseases such as heart diseases, kidney failure, and eye damage, which may lead to blindness, and foot ulcers, which may require limb amputation. So while diabetes can be partially inherited, several lifestyle factors such as obesity, high sugar consumption, and lack of physical activity can significantly contribute to the progress of diabetes. The most common causes of NCDs are metabolic and behavioral risk factors and can be largely preventable by several available means. The most global discussions concern the risk factors of self-management. For example, the tobacco and alcohol consumption, physical activity, weight, food, and dental health care, and focus on the role of individual responsibility to manage risk factors of NCDs. So healthcare specialists should educate patients about their nutrition value and raise the profile of didactics, practicums, and workshops in daily practice. Further, the management of NCDs is the priority of the public health sector in most countries because management in society is the main direction of NCD prevention. Interventions are used in public health management in an effort to promote good health behavior. And I'd like to cite India as an example from an article that I read. India, with its wide social, cultural, economic, and geographical diversity, is implementing multi-sectoral actions to prevent NCDs, including school health programs, initiatives of National Cancer Control Program, National Trauma Control Program, National Program for Control of Blindness, and National Mental Health Programs, National Tobacco Control Program, and the National Program for Control of Diabetes, Stroke, and Cardiovascular Disease initiatives. So from another approach, researchers also highlight the environmental factors, which are air pollution, climate changes, sunlight, and their impact on NCD development. Since diet is a common risk factor among most NCDs, it attracts more attention in an effort to find effective strategies to provide healthy food to the community and at all stages of life. Evidence-based nutrition interventions should be a global health priority, and the role of the dietary fat studied should be modifiable variable in the prevention of NCDs. Recent evidence suggests that a diet that is high in healthy fat and rich in saturated fatty acids prevents the development of metabolic diseases and reduces cardiovascular events. So strategic health communication in the population wide intervention includes engaging the food industry in order to reduce the salt content in foods, limit sugar, and saturated fats. The concept of a sustainable diet combines health and environmental concerns and includes risk factors as part of the recommendations to reduce processed meat consumption and to increase whole grain consumption. Okay, so the prevention and control of NCDs, an important way to prevent and control NCDs is to focus on reducing the risk factors. So while risk factors can be specific to each disease, an effective public health strategy to address NCDs at the population level is to focus on the most common risk factors. And there are proven cost-effective strategies to address these. They include this one, reducing smoking through actions such as education, smoking cessation programs, bans on smoking, advertising bans, and increasing taxes and prices of tobacco products. For the physical activity, promoting physical activity through actions such as media campaigns and community-based education programs, promoting physical activity as part of routine primary healthcare services. 4, promoting healthy diets through actions such as reducing salt intake, eliminating trans fats, and raising taxes on sugar, sweet, and beverages. Reducing the harmful use of alcohol through actions such as bans on advertising, limiting access, increasing taxes, enforcing drink driving laws, and psychosocial interventions to people with harmful alcohol use. So these go hand in hand in with other preventative strategies such as early screening, effective management of disease and managing complications, and at a broader level, addressing the social determinants of health. Okay, so in conclusion, in modern society, NCDs are the main challenge in health systems. Risk factor management is essential in NCDs management. The management of NCDs requires many strategies from several perspectives and on different levels, including the individual and country levels. Modern strategies for the management of NCDs should be oriented toward the individual level, where the individual is responsible for their health by simply following a healthy lifestyle. And it is important to combine modern scientific achievements and innovative decisions with regard to the rationality of nutrition and positive effects on human health. Governments and international organizations should make people aware of their health and their environment to make the world a safe and healthy place. So that concludes my lecture. Terima kasih banyak.
Janice. Is that true? Is that right? Maraming salamat.
Yes.
Thank you. I mean, thank you.
Maraming salamat is thank you.
Yeah, maraming salamat. Okay, thank you very much, Miss Janice, for giving us such comprehensive presentation for second session. I know it was such an interesting topic that healthy lifestyle is still most important thing to prevent and control NCDs, right?
Yes, that's right.
I'm sure with your presentation, there will be many curiosity from the audience who wants to ask you. And we are glad to receive so many questions here from online and of course later offline.
Sure.
Okay, can you help me, the committee? We have one question online from a student. Okay, it comes from Melan. As health students, we get busy, which makes us sleepless and also consume a lot of caffeine. How do we keep our bodies well, nourished while our lifestyle habits are bad? Maybe you can explain. You can answer it.
Recording in
right?
progress.
Can you get the question?
I'm sorry, I didn't quite. Okay.
Okay. You can see.
You get busy, which makes us sleepless.
As health student, we get busy. It's always we do that every day.
Oh, I believe that it's only about time management. I know that being student is take most of your time, but you know, if you have this time management, you can always schedule your activities, and so you won't be you will not be able to have sleepless nights. Oh, do you get what I mean? It's only about time management, and nowadays, I know that we are in a fast-paced world, right? So I advise that you should always have a complete or enough sleep, because if you don't have enough sleep, then that's the time that stress gets in and non-communicable diseases. It's like paving the way to the non-communicable diseases. All right. So as students, you also have to take care of yourself, because sooner or later you will also get to take care of other patients. So with that, I think that time management is of essence. Okay. Thank you. I hope I get to answer your question.
Okay, thank you. So you mean the case is time management, right?
Yes.
Okay, next, we open a question from on-site participant too. So please raise your hand, mention your name and institution, and yeah. From there, the committee help me to give them microphone. Oh, okay, you can start.
Okay. Thank you for the time. But first, allow me to introduce myself. My name is Muhammad Ali Akbar, and I'm from Polytechnic of Health, Ministry of Health, Banjarmasin. And I have a question for you. As you can see from the previous slides, mental health disorder, or I can say stress, is also one of the non-communicable disease. And as a student, we often face stress because of campus or personal problems. But sometimes we don't realize that we have stress. And my question to you is how to recognize and overcome stress? And is there any tips to maintain our mental health? That's all my question. Thank you.
Okay, thank you, Muhammad Ali, right? Okay. He asked about how to recognize and overcome stress, and is there any tips to maintain our mental health?
Okay. Okay, how to recognize stress is when you feel anxious already, so much anxiety and so much worries. You think you tend to overthink. That's and then it's like you can't do or you can't work properly anymore. That's that's, I think, sign of stress, no? So how to manage this is you have to first how do you call this? I can't express myself in English that very much. So it's for you to take deep breaths, no? And try to think about what you need to do, gather your thoughts so that you will be able to think of the proper ways on how to deal with any anxiety that you are experiencing. Okay? And try to divert your attention or your stress. You can also try to talk to your family or friends, because having someone to talk to also kind of is our stress and anxiety or worries. And what was the third question again?
Your question?
How to identify stress, how to manage it, and what's the last?
Yeah, he asked about tips to maintain the mental health.
Oh yeah. Well, that's it. You can try to divert your attention to other activities that can lighten up your mood. and you can try to um, you can try to do some things that can help you deviate or make your uh, anxieties uh, go away. Okay, so mental health is very important, and um, uh, with by not being able to manage stress can also increase the prevalence of you getting non-communicable disease. So that's it.
Want to ask again from these groups? Want to ask from these groups? Okay. We have come to the end of oh, there, yeah, yeah, oh there, yeah, yeah, oh there, yeah, yeah, oh there, yeah.
Okay, thank you moderator for the time. My name is Polytechnic of Health, Minister of Health Banjarmasin. I have requested our speaker of Health Banjarmasin, Ms. Janice. There's growing during our unhealthy. Our government regulation prohibit the sale of unhealthy food and for non-communicable diseases.
I'm not
Yes,
quite
ask
getting the
about,
question.
snacks. But most of these food drinks are unhealthy. Food and drinks effective enough to control risk factor for non-communicable disease?
Oh, I'm sorry, ma'am. I didn't quite get the
I don't think
the
so.
whole of the question.
Yeah. Pardon me?
I didn't quite get the whole question.
Yeah. She asked about the snacks, unhealthy snacks that in this moment, there are so many unhealthy snacks, but is there any government regulation for that? So it can control risk factor for non-communicable disease, because the unhealthy is like junk food, too many sugar there, and too many unhealthy food. In Indonesia, actually, we can find a lot of unhealthy food here.
Ma'am, I'm sorry, but you came a bit choppy, so I didn't get quite the question. I didn't quite get the question. I'm sorry.
Yeah. We are going to type it. Contemporary snacks. It's like foods and drinks in this moment. So it's a lot of sugar, sometimes a lot of many kinds of unhealthy things in that food or drink. We are right write the question on the chat box. You can see that, Miss Janice, on the chat box.
Okay.
Prohibition for the government.
Oh, we don't have any, we can't really prohibit unhealthy foods, no, because that's where some of the, it's kind of business. It's business. So while the government campaign over being healthy, we can't really say, or we can't really impose, or the government can't really hold on to minimizing the business of unhealthy foods, the junk foods, like that.
Okay, so we need a regulation, right, from and collaboration for all the multi-sector, I think, yeah. Okay, thank you so
Yes.
much, Ms. Janice, for your answer. And I guess we have to continue with our next session. So we have come to the end of the second presentation. Ladies and gents, I'm so sorry, the time is up, so I guess we have to say thank you to Ms. Janice for her time to be here, and the explanation, it's very good, so we can learn a lot of NCDs and how to arrange our lifestyle. Okay.
Okay, thank you.
We have come to the end of the last session. So please give applause to the speakers, and for you all, thank you so much, Ms. Janice. And before we end the session, please stay there because we will give you a certificate as our appreciation to both of you. Thank you. For that, I'll deliver it to the MC.
Okay, we thank you, Mrs. Tini Elin, for providing us with informative and fascinating session. Our highest gratitude to our speaker, Mrs. Janice Sumabat, MS Jemet, for such informative and thought-provoking presentation. So, as a token of our gratitude, allow us to present you with a certificate of appreciation. To present the certificate, I'd like to invite Mrs. Anjar Novia Tiningsi, SKM MKes, as the Head of Academic Administration of Health, Polytechnic Ministry of Health, Banjarmasin. Mrs. Anjar Novia, time and screen is yours.
Yes. Hello, Miss Janice. I am Anjar Novia as the head of Academy Administration of Health Polytechnic of Ministry of Banjarmasin. On behalf of director and the committee, allow me to extend our humble gratitude for your valuable presentation in this seminar. Please accept this certificate as a keepsake of our appreciation of you. Give an applause. We're looking forward to many more opportunities and for further engagement and collaboration. Once again, thank you.
Thank you, Mrs. Anjar Novia. And again, thank you so much to Mrs. Janice for taking the time to speak to us today. Honorable speakers, should you have another agendas to attend to, you may leave the Zoom meeting room. Thank you. Okay, ladies and gentlemen, we will take a short break, 10 minutes break from now. Please enjoy this brief interlude, and we will reconvene shortly to delve back into our exciting lineup of session. Thank you so much. Kami persilakan kepada Bapak Ibu tamu undangan untuk menikmati snack. Kita akan break 15 menit. Terima kasih.
Tampar pisang, pisangku belum masak, masak sedikit diurung bari-bari, manggalepok, patah kayu pingkok, pingkok di mata apinya cancurupan, rasa sayang, sayangi, dari jauh, rasa sayang sayangi, rasa sayang sayangi, dari jauh, rasa sayang sayangi. Pisang-pisangku belum masak. Waktunya kita ngomong. Some people believe it doesn't run, and that's the only thing. The silver lining, nothing at all. If I got the something memory, sometimes everything means nothing. If I got you, but I don't nothing at all. You feel like you, baby. If I got something, sometimes everything means nothing.
Mitube ganti popo.
Okay, we'll move on. A song from Adele. The title is Chaos. My heart is a door. I wanna see you. Then say it. I love you. Say everything. Like we're not scared of what is coming. Love of God. And we are. There is nothing. It's in your eyes. My eyes stay still. Oh, like you. Only wonder. It's
Okay, thank
Okay, let's
you.
give applause to Miss Kartika. Okay, ladies and gentlemen, welcome back, everyone. I hope you had a refreshing break and had the chance to network and grab some refreshment. Distinguished participant, we will now begin our third presentation. Please allow us to introduce our second moderator for this session. Our third moderator is Nurse Evi Marlinda, SCUP, MCUP, Specialist CUP AN, and she got her bachelor from Gajah Mada University and her master from Indonesia University. She is now currently a lecturer and also a chief of Diploma Nursing Study Program, and she is specialized in pediatric nurse. Ladies and gentlemen, please give a warm welcome to our moderator, Nurse Evi Marlinda, MCUP, SPCUP AN. This session is a bit different as we will have to be able to interact directly with our speakers on site. So before commencing the session, allow us to invite our speaker for third session. Distinguished speakers, Dr. Mahdalena, SPD, MKes, and Mrs. Retno Ayu Hapsari, SGZ, M Clean Nutrition. Would you please kindly come forward and join us and Miss Evi Marlinda on the stage. Thank you and please have a seat.
Okay, good morning all, ladies and gentlemen. Honorable Director, Polytechnic of Health Banjarmasin, Dr. Parelangi SK Nurse MCUP MH, our esteemed speakers who attend to this seminar, and distinguished participants, online and offline participants. I am Evi Marlinda. It gives a great pleasure to be the moderator for the third presentation session of the second international seminar Polkaisin, update on non-communicable diseases, prevention, control, and alleviation. And welcome all of you to this seminar. Let us greet the speaker for this session. Hello, Ms. Retno Ayu Hapsari.
Hello, Miss Evi.
Hello, Dr. Mahdalena.
Hello,
How are you
Miss
today?
Evi. I'm fine, thanks.
Okay. How do you like stay here so far, Ms. Retno?
Really comfortable.
Okay.
Yeah.
I hope enjoy in here and enjoy at this time. Thank you. Okay. Thank you for both of you for taking your time to present in this occasion. Ladies and gentlemen, before the start of this the presentation, let me tell you how this session will run. In this session, there will be two speakers. In both speaker will each take about 20 minutes to present. We are going to conduct this third session as panel presentation. Again, I kindly remind you to put device on silent mode on online participants and kindly click the link to submit the question via slide.do. Distinguished participants, we will commence our third session presentation. Allow me to read a brief intro to our first speaker. Our first speaker is Ms. Retno Ayu Hapsari, SGSM Nutrition and Diet. She was graduated from Brawijaya University on her bachelor program and at University of Wollongong, Australia on her Master of Nutrition and Dietetic Program. Currently, she is a junior lecturer at Nutrition Department of Polkas Raya. She has published several research journals on national and international journal portal. Without further ado, now allow me to welcome Ms. Retno Ayu Hapsari as this Nutrition and Diet to present the material on contribution of environmental risk factor of non-communicable diseases. Ms. Retno, time and floor is yours.
Thank you, Ms. Effie, for your introductions. And I also want to thank you to the committee for having me. It's a really great honor to be here to share and to discuss. But before that, I would like to say to the Honorable Director of Health Polytechnic, Ministry of Health Banjarmasin, and all the distinguished keynote speakers and participants. And here I would like to share my thoughts, our thoughts, our concern about the NCDs, and present about the environmental risk impact on non-communicable diseases. Can I use this? Or is it just for the, oh, I don't. Can you help me with this thing? I'm sorry, it's a bit, it's not working? Okay, so I will say slide and then you keep change the slide. Okay. Sorry. And the first slide. Okay, this is actually we've already heard about these things, from the previous speakers, and this is the introductions, the breakdown about the NCDs. And NCDs, one of the biggest health challenges in the 21st century, and become a global concern in both developing and developed countries. And it's very responsible for 41 million, so 57 million deaths, or we may say that approximately 71% globally. And it's also responsible for 75% of premature deaths. And the big four of NCDs responsible for 80% premature death, including cardiovascular diseases, around 44%, followed by cancer, and then followed by chronic respiratory disease, and lastly, followed by diabetes at 4%. Okay, it's really good. I can change the slide by myself. Okay, thank you. So if we have a look with our history of NCDs, so this is the data that I took from basic health research. This is the comparisons from the basic health research at 2013 and 2018. We can say that the prevalence NCDs in Indonesia is getting higher from the previous year in 2013 if we compare it to the 2018. So the question is, what's going on between this discrepancy of years? It's only 5 years, but the prevalence is getting higher. And the other things that I would like to, it doesn't work again. I'm sorry. Oh, it works. Sorry. Okay. If we also want to have a look at the top 10 rank of DALY, or disability adjusted life years lost on the back years in the 1990s, and we compare it to the 2017 Indonesia. Back in 1990s, we can see that the cause of death is mostly because of communicable disease, atau kita yang seringnya mungkin penyakit infeksi. Yeah, it's for, oh, sorry. Okay, we may say from the top rank, yeah, the cause of death, like, for example, lower respiratory infect, diarrheal diseases, tuberculosis, but it changed in the 2017. From the non-popular one, it becomes the top rank and took over being the cause of death in 2017, which is it's almost the non-communicable disease, such as stroke, ischemic heart disease, diabetes, and the first one in the 1990s, getting in the fourth place. It is the neonatal disorders and followed by other communicable and non-communicable diseases. So the stage change, it also make us to be concerned what's going on in Indonesia. But I will we already know that a lot of risk factors, and it's already discussed with the previous speakers. But I would like invite you, yeah, to discuss in the point of view from the environmental risk. So the question is, how do environmental risk factors affect NCDs? Now, according to the World Health Organization's environmental health comprises the aspects of human health that are determined by physical, chemical, biological, social, and psychosocial factors in the environment. And according to that, environmental risk is like a breakdown into the several domains. The first domain is about the physical. It includes the water, air, food, soil, and etc. And how about the chemical? Chemical here includes the insecticide, pesticide, fertilizer. Kemudian about the biological domains, it's about the plants, rodents, insects, and microorganisms. And about the socials is we're going to talk about society, culture, customs, occupations, religion, and etc. And from the various domain, various risk factor, yeah, here is the attributable fractions of NCD for selected risk factors by disease group. So from here, we can see that in 2016, air pollution is the largest risk factors of non-communicable disease just after the tobacco smoking. So the first place is tobacco smoking. But the second one who can cause the non-communicable disease comes from environment. Came from our environment, which is the all air pollution. Yeah. And according to research, it's approximately about 91% of people worldwide contaminated by the air pollutions, which can put ourselves, put our families in a high risk of getting NCDs. And so, I would like to share about the concept of exposome. Actually, the Miss Janice has already discussed a bit about this one. If you can still remember about the higher you expose to a risk, the higher you're getting NCDs. So this is the same concept about the exposome. So the exposome is the accumulations or measure person's lifetime of environmental exposures and impact on health. So it's kind of like accumulation from you just being a baby, then you're growing up, childhood, and adolescence, middle age, and then in the elderly. So the accumulations of the risk factor is being accumulated. So we start from here. Environmental exposures can accumulate in your body from the air you breathe, the food you eat, then products you touch, the water you drink, and anything. Even mostly here is women, even from the cosmetics that we use, it might be one of the exposure. And all environmental factors are associated with more than 80% of human diseases. And it may say like 1 in 60 deaths worldwide is because of this exposure. And the exposure is a critical drive of human health and disease, including cancer, cardiovascular diseases, respiratory infection, autoimmune disease, and stroke. And as you already know that one person have like a different response to like a danger from outside. So each person exposure is unique. Maybe even though if we live in the same place, probably we have a different like a result at the end. And exposure research focus on individual environmental exposure as of preventions and possibly of interventions. And every person has a unique, like it's, we may say it's kind of like a similar to DNA. So one person is different to another person's. So every research, if we develop and focus on this exposure, we may individualize treatment or interventions for each group. And here's for the example. This is the characteristic of the urban environments and individual behavior risk factor related to NCD. So probably people who live in urban, who live in city, will get a different problems in NCD with the people who live in the village or in the rural area. So for example, if you live in the urban, there are a lot of things going on, like our neighborhood, our socio-economic status, it affects about the tobacco environment, physical activity, because we tend to dependent to like driving a car, then food, just like the previous questions about the unhealthy food choices, then about the alcohol environments. So all these things about, we can say as the social and physical domain, environment domains, it affects our individual measurements of NCD behavior risk from getting like having a high risk because of we use the tobacco, we do rarely physical activity, so physical inactivity, then we eat unhealthy diets because we loves to talk with each other and having alcohol. So it's put us having a high risk of getting NCDs. This is for another example, how environment affect our body through the external exposome and internal exposome, then how they can be or how they result as a NCD. For example, here we live in a high urbanizations where in a city a lot of air pollutions, probably from the industry, probably from the car, even in our house. If we cook, we also produce an air pollution. So it will become the specific external exposure through the air and chemical pollutants, and it may alter endothelial functions, inflammations, and insulin resistance. So in this case, we can put ourselves having a high risk of increased type 2 diabetes. Another example, If we live in a rural area, which is have a lot of green space and have we can walk with the beautiful landscape and we have a fresh air, then we love to do the physical activity. We want to walk, there's no car, we have the rides, we can walk safely, we can see the landscape, we can breathe the fresh air. We love to walk. If that's happened, it may lower insulin resistance, lower BMI, and resulting decreased type 2 diabetes. So environment is really put us in a like vice versa. If we live in city, this is going to happen. If we live in a rural, this is going to happen. So it's the same as the previous concept. If the one person is different to another person. So this problem in the city will not be the same as the problem maybe in the rural area. So if we talk about the environmental risk, we will talk about the global environmental changes. So the global environment changes include climate change, biodiversity loss, freshwater depletions, tropical deforestations, overexploitations of forest fisheries, oceans acidifications, soil degradations, changes in nutrients, cycling, and environmental loading with persistent toxic substances. And we will discuss it shortly. So the first one is air pollution. I already discussed it a bit in the previous slide. So air pollution is defined as any substances in the air that may harm humans, animals, vegetation, or materials. And usually it apa istilahnya disebut sebagai particulate matter or PM. And according to the Global Burden Disease Study, the air pollution ranked fifth globally as a mortality risk factor in 2015. And another study said that ambient PM exposure is attributed primarily to NCDs, including ischemic heart disease, cerebrovascular disease, chronic obstructive pulmonary disease, and lung cancer. And also the ambient PM 2.5, this is like the size of the particle that's already on the air and contributed to approximately 3.2 million incident cases of diabetes and 82 million of disability just life years caused by diabetes and 206,000 deaths from diabetes. And we talk about climate change. So according to the systematic review of the impacts of cyclone, flood, and storm-related disaster, it can impact on NCDs. The increase of hot weather comes with the climate change is associated with the increases in mortality, in emergency presentations, and in hospital admissions due to cardiovascular, respiratory, and renal disease. Because during this time, people is focused on overcoming the problem. And when it's happened, just like there's a flood, and it's really difficult to transfer the patients to the hospital. So make it the cardiovascular disease getting worse. And both hot and cold weather is associated with a reductions in physical activity, and reduced physical activity is a risk factor for cardiovascular disease. How come? In the cold weather, people is getting like, okay, I'll stay in the blanket. It's too cold. I don't want to run. I don't want to walk. But on the other hand, if it is too hot, it's the same. Oh, it's too hot. Okay, I'll just stay at home. I want to the aircon. Or if we want to go outside, we probably choose to use like a motorbike, which is faster, or a car, which you can use the aircon. So it's problematic, isn't it? Just like in the cold weather, kalau di bahasa kita it's too mager, terlalu mager untuk beria. And in the other hand, if it is too hot, we also like, oh, it's too hot. Okay, let's stay inside. And another thing is about the climate change, about rising sea levels, together with excessive groundwater withdrawals. It makes the saline intrusions of groundwater in a coastal area. So the water is getting saltier because the sodium or the natrium or the salt from the seas infusions to our groundwater. And then people will drink that water. It means that increase the salt intake of affected populations. So without any our concern, we also take the higher sodium intake into our body. And climate change may increase the risk of kidney disease. Kidney stone formation seems to vary with the temperature, perhaps a result of relative dehydrations and resulting urinary concentrations. Okay, this is just like a brief review how the climate change impact the health outcomes. There is a few colors here, which is the orange field shows the direct health impacts, and then the blue field show the social impacts that follow the climate-related environmental changes. And the less direct impacts are shown in the lower part, and the red field shows the 5 categories of indirect health impacts. And lastly, on the bottom is the tertiary effects indicated by upward pointing arrows. And so about the urbanizations, because we live in a city, it's really related to us. And according to a systemic review, found that 25% of urban ambient PM air pollution comes from traffic, 50% from industrial activities, and 20% from domestic, like fuel burning during our cooking activity, and 22% from unspecified sources of human origin, and 80% from natural dust and salt. And these combinations, as I said, probably in if we live in city, we're too dependent to our like facility. For example, our motorbike, our car. We rarely do walking to the office, probably because our home is too far, our house is too far, so it will be easier if I drive my own car, if I drive my own motorbike. So, and in this practice, we could say that we contribute to climate change, to the regional air pollutions, and to sedentary lifestyle. And the other things that is quite interesting is about noise. So noise is the common exposures in the city caused by traffic, machinery, and other sources, which are also give a global environment changes contributors. So noise is kind of like a stressor that contributes to a range of NCDs, including hypertension, cardiovascular diseases, anxiety, sleep disturbance, and hearing loss. And another thing is about the crowding. Crowding means people tends to live like in one place with a lot of people, and they doesn't want to go. So, and in these situations, it may promote to chronic stress, contaminated indoor air due to the use of solid fuels, exposure to temperature extremes, injury risk, and getting to higher chance of getting respiratory diseases.
Excuse me, Ms. Rutna, 5 minutes time remaining.
Thank you. Thank you for reminding me. Okay, this is quite interesting. It's about food, nutrition, and agriculture. It's kind of like a vice versa effect. So the climate change or the environmental can affect to our dietary pattern. On the other hand, our dietary pattern also can affect or can be impacted full to the environment. For example, the global dietary transition marked the consumptions of energy dense. We love to eat the meat product, and but which it could be like promote to the pattern of deforestations, because for the agriculture to the farm and contribute to the greenhouse gas emissions, which in turn contribute to NCD risk and to biodiversity loss. And actually, according to the meta-analysis, the 130 varieties of plants that elevated carbon dioxide from the soil, it can reduce the overall concentrations of 25 important minerals in plants, including calcium, potassium, zinc, iron, and 81% on average. On the other hand, also there's a strong evidence that this kind of elevations of carbon dioxide also can decrease the protein and and increase the carbohydrate levels in the particular crops. And here's is that I said that our dietary choices also influence the food productions, influence the environmental impacts. That's why a recent study finds that small shifts in the food choices could have outsized benefits to both health and planet. This is the figure. You can have a look at. According to this figure, the highest ranks of that food that we consume is the meat product. We less consumes in the plant-based meal. And this is the another example that we can see here that we low whole grains consumptions. It means that we eat too much meat product and we are inadequate or decrease intake of plant-based, just like a grain or fruit or the other things. And this is about the persistent chemicals of the environment, which is the pollutant from chemicals. Is also known as the endocrine disrupting chemicals. It's also mostly released during the manufacture, and it has a bad impact on the human. And I believe you already know about the various examples of sources of endocrine disruptors on the chemical pollutants. And also about the persistent organic pollutants, it can be associated with the metabolic conditions such as adiposity, insulin resistance, and dyslipidemia. And another thing is about the metals is also collectively contribute to many NCDs, including neurobehavioral abnormalities like increased lead or mercury in the body, then the cardiovascular disease, renal disease, and some cancer. And if you have a look at this map, this title with the total plastic waste generation by country, measured in million tons per year for the year 2010. And this is burden from non-communicable diseases from 1990 to 2016. And Indonesia is with the brown color. Brown color means that the plastic waste is about is a bit higher. Yeah, so we need to put our concern here, how we can reduce our plastic waste, because according to these trends of global diabetes, obesity, and plastic production, it's like a very in line in trends. If we use or if the productions of the plastic is getting higher, it also put us really in a high risk of NCDs also getting higher. And about the biodiversity loss, it's mostly about the pollinator loss and fisheries depletions. And so our production of healthy food is decreased, and it may have the bad impact on our health. And this is another thing about tobacco use and alcohol consumptions. And it's also already been a little bit explained by the previous speaker. I won't explain it further, but here is based on the basic health research data that mostly in Indonesia, we don't usually drink alcohol. Actually, it's only about 3%. But still, alcohol is casually linked to the various degrees of the different cancer, different NCDs. And I would like to conclude about my presentations that there's a link between environmental risk factors and non-communicable disease. It's a very complex and multifaceted issue. And exposure to various environmental pollutants such as air and water, contaminants, pesticides, and industrial chemicals has been associated with an increased risk of developing NCDs. And recognizing and understanding the intricate connections, because it's too complex, because it's connected to the other things and the other things connected to the other things. We need to recognizing and understand those links, because if we know and if we understand, we can develop effective public health policies and interventions. And lastly, a holistic approach that integrates environmental conservations and health promotions is essential to reduce the burden of NCDs and create a healthier and more sustainable future. I think that's all that I could share with you today. And thank you, and I will give back to the moderator. And here's all the references if you want to read more about all of the things that I share in my presentation. Thank you.
Thank you very much, Retno Ayu Hapsari, SDM Nutrition and Diet, for giving us such informative presentation. It was such an interesting topic. That NCD, I note that NCD is one of the biggest health challenges in the 21st century. Then, environmental factors that contribute to NCD are physical, chemical, biological, and also social. I note air pollution, climate changes, and so on. Okay, thank you so much. Okay, next, let's go to the second speaker. Our second speaker is Dr. Magdalena SPD MKes. She was graduated from Airlangga University on her doctoral program. Currently, she is a lecturer and also as a chief of language development unit of Polytechnic of Health Ministry of Health Banjarmasin. She has also published many research, both national and international, especially in hypertension. And she is also specialized in public health community. And ladies and gentlemen, without further ado, let us welcome Dr. Magdalena to present the hypertension on young adult. Dr. Magdalena, time and floor is yours.
Okay, thank you, moderator. Good afternoon. Okay, Honorable Director, distinguished speaker, and esteemed colleagues and participants. Thank you for the warm welcome and opportunity to speak at this prestigious international conference. Okay, today I'd like to discuss an increasingly relevant topic in the health field, namely hypertension. Okay, thank you. The recent research in the US, as shown displayed, is significant decrease in mortality rate of CVD. The decrease is less pronounced in age range 18 to 30 years, have lower rate of death from cardiovascular disease. Hypertension is most important risk factor for stroke. Increased prevalence of high blood pressure among US young adults. Hypertension awareness treatment control remain among US young adults. Hypertension in the young 18 to 25 years and middle age 25 to 44 years adult has become a serious public health problem worldwide. According to the estimate, more than 1.56 billion people will suffer from hypertension. Hypertension is quite common in Chinese people aged 28 years or over. Although the prevalence of hypertension is higher in elderly people, there is an increasing prevalence in the adolescent population. However, the effort diagnosis hypertension in the young adult is lower than in the middle age. Screening for hypertension among young people is less performed, and doctors are less likely to prescribe antihypertensive drug to young adults. Okay, ladies and gentlemen. Risk factor for hypertension is the young adult, consists about excessive sugar intake, alcohol consumption and smoking, obesity, diet and physical fitness, family history, gender, illiteracy, and socio-economic status. Okay, let's discuss one by one. Okay, next. The first, excessive sugar intake. Consumption more than 10 grams of sugar per day in their diet has a higher risk of developing hypertension. Excessive sugar intake has been identified as a major risk factor of hypertension. The average Asian diet has a higher sugar content than the average Western diet. Okay. Okay. The second, alcohol consumption and smoking. The most prominent risk factor of hypertension in modern society are alcohol and smoking. The risk factors have been shown to be more responsible for the development of hypertension is various studies. And the third, obesity. Obesity is caused by an imbalance between energy intake and energy expenditure. Genetic predisposition does not automatically cause obesity, but eating habit and physical activity pattern may play a more significant role in weight gain. For young women, having a high body mass index over 25 kilograms per meter square is the main risk factor for hypertension. Okay, ladies and gentlemen, the next risk factor, diet and physical fitness. Diet and physical exercise, it's also one of the risk factors in developing hypertension. Poor diet, especially increasing consumption of oil and fatty food, and low in protein and carb contribute to the increase in the prevalence of obesity, which led to high blood pressure. Suddenly, lifestyle further elevate this rate as the lack of physical movement, there will be an imbalance between energy intake and energy expenditures. Adding with poor diet, the risk of acquiring hypertension is much higher. Okay, ladies and gentlemen, we have already discussed several risk factors of hypertension. The first factor, sugar consumption, smoking and alcohol, obesity, diet, physical exercise, and now let's take a look at the another factor. Family history. A child has a higher risk of developing hypertension if both parents suffer from hypertension. Children of hypertensive parents are at even greater risk if factors such as smoking, drink alcohol, eating food high in fat, and lack of physical activity are added. Research shows there is a significant relationship between hypertension and genetic. Okay, next. Okay, honorable attendee, the next risk factor related between gender. In men's gender, men and women, in men smoking and alcohol consumption, variable may contribute to the onset of hypertension. But the women research show that hypertension affects women the most. Most rural women stay at home, don't move much, and rarely leave the house. Okay, next. The next risk factor related to awareness and knowledge, that is illiteracy. Illiteracy has been mentioned as one of the risk factors. It is due to the fact that lack of education or illiteracy might hinder the dissemination of information on health, education, and literacy. Hence, influence the likelihood of other risk factors acquiring. Okay. Poverty and lack of education are problems that contribute to health in developing countries. Health literacy risk factor can influence the likelihood of the other risk factor occurring. Okay, ladies and gentlemen, we have come to our final risk factor of the hypertension. Socioeconomic status. High socioeconomic status. The majority of the hypertension sufferers are people with middle and upper class jobs. It is possible that less physical activity causes a greater risk of hypertension. And low socioeconomic people in the low socioeconomic condition that are likely to cause hypertension, lack of nutrition food, inadequate knowledge about hypertension, lack of potassium in the diet, and increased salt consumption. Honorable attendee, it summarizes the list of the risk factors in hypertension are including excessive sugar, intake, consumption, and smoking, obesity, diet, and physical exercise, family status, gender, illiteracy, and socioeconomic status. As we reflect on the discussion, we may draw a conclusion that is the end of the day, those risk factors are highly linked with awareness and effort of individual government and health provider. So let us be more aware of avoiding the risk factor of hypertension mentioned earlier and lead a better and healthier lifestyle. Okay, thank you very much.
Thank you so much, Dr. Magdalena, SPD MKes. It was such an interesting topic. Especially, we know that people with hypertension are elderly, but now at a younger age is also increases. And hypertension is a silent killer. And I note that some of the key risk factors are unhealthy lifestyle, include smoking, drinking alcohol, being overweight, having a family history of hypertension, becoming older, eating healthy foods, and suffering from diabetes, and so on. And as a younger generation, we must avoid such risk factor to prevent further complication. Okay, I'm sure with such informative ideas, there will be many curiosity from the audience. We are glad to receive so many questions, and due to time limitation, maybe we are going to select two more online participant. Okay. For the committee, please help me give the microphone for the audience, maybe for this is for student, our student. This from our lecturer. And for those who wants to give the question, please raise your hand, mention your name and institution, and to whom the question directed to.
Thank you, Mrs. Moderator. Let me introduce myself. Myself is Negi Kai, and I'm a lecturer from Dental Health Department. I am actually interested about the topic that Mrs. Ratna has been told about. I've heard that I actually want to confirm about one thing, that if we eat rice that have been sitting one night in the refrigerator and we reheat it again, it can lower the sugar level on the rice. So I want to confirm, is that true on the side of nutritional field? And I want to ask, maybe you have some suggestion for us who wants to lower our sugar and calorie intake, because actually I'm on a diet and some of my friends on a diet. Because we both know, we all know that sugar and calorie intake is actually related on the NCDs. Thank you.
Thank you so much for your question. Maybe for Ms. Retno, welcome to Ms. Retno to elaborate the question from the participant.
Okay, thank you. It's kind of interesting topic to discuss actually, because there are too many advertise also about the things. We say like rice cooker to make our the rice sugar level is lower, and actually the thing is that makes the sugar level in the rice is based on the chemical strengths on the rice itself. Like, how we say, if it is Indonesia, I'm so sorry, kalau berasnya itu lebih pulen, itu akan sugar levelnya is higher daripada beras yang tidak pulen. Contohnya aja misalkan dengan, for example, for the probably Japanese rice, itu pulen sekali, itu akan sugar levelnya, atau we may say the glycemic index things, itu is higher than beras Banjar rice. Jadi karena dari komposisi chemical itself, then when you put it in the refrigerator, it's kind of like a break it down the chemicals. That's why if you want to like experimental, just put the rice in the refrigerator and then you reheat it. It will make the beras is tidak sepulen sebelumnya. Nah, that's why that there's also like actually interesting article say that it make the sugar level is lower. That's the thing. Thank you. Hopefully it's answer all your questions. Thank you.
Okay, Miss Ratna. Oh, Miss Maggie, does it answer question? Okay, thank you. Okay, maybe there is online participant. Oh, we have another participant from Miss Emilda. To whom your question directed to? Okay.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name Emil Dasari. I'm from professional organization PT GMI and also as a lecturer at Banjarmasin Polytechnic. I want to ask to Ms. Retno, how does noise contribute to voice non-communicable disease? Please for the answer. Thank you.
Noise. I think noise, yeah?
Yes.
Okay. How noise contributes to range of NCD?
Thank you for the questions. It's another interesting questions as well. Actually, I've already discussed a bit in the slide in the urbanizations topic, which I said that noise is one like a stressor. So it is hypothesized that noise is involved in dysfunctional stress mechanism, and due to the stress, it will like affect the cardiovascular changes in such like the changes in catecholamine, epinephrine, norepinephrine, adrenaline, cortisol, and all of those things can contribute to the vascular autoregulations, such as make us the the vasoconstrictions on the blood vessel, and then the increase the heart rate, and then increase the arterial blood pressure. Those all of these things causing hypertension, which is one of the risks of getting the other NCDs, that's like cardiovascular diseases. So probably if you can be experimental by yourself, if you want to sleep and it's too noisy, too busy, you won't get a good sleep, isn't it? Because you're getting anxious, your body is not relaxed, can be like, because noise can like induce the chemicals in our body, epinephrine, cortisol, and all of this makes our body more stressed. And that's all the things makes our blood pressures getting higher, vasoconstrictions because of the vasoconstrictions of the blood vessels. That's why the noise is significantly related to NCDs. Thank you.
Mamelda, does it answer your question? Okay, thank you. Is still another side participant maybe? I think we have a student. I think in the behind. Oh, okay. There's another staff. Okay. Please, our committee, give the microphone to Miss Anjar. Thank you. And Miss Anjar, please mention to whom the question directed to.
Okay, thank you, Miss Evie. I would like to ask to Miss Magdalena. How genders really affect to hypertension? As far I know, nowadays woman is works too. So how genders affect to hypertension? Otherwise, for women, it decreases opportunity for causing hypertension, isn't? And also less of women does smoking and alcohol consumption. Thank you.
Okay. Please, Dr. Magdalena, to elaborate the question from Ms. Anjar.
Okay, thank you, Miss Anjar. It's your question is very good. Yeah. Okay. It is true that women more prone in suffer from hypertension compared to the men, because it's actually both men and women can have high risk of hypertension. But it different range, age range, different about age range. The data show the man has more risk of suffering from hypertension compared the women. The age below 55 years, but meanwhile the women in age upper 55 years old have risk of hypertension, because women after of 55 years old get to menopause, yeah. And sometimes women use about contraception aid, for example, hormonal contraception, because hormonal progesterone and estrogen and progesterone influence about the badan in Indonesia pembuluh darah, because if hormone progesterone and estrogen and progesterone make the pembuluh darah make shock, but if upper 55 years old, is estrogen and progesterone can be released from the body, and women more hypertension with if use about hormonal contraception, and after age 25 years old. But the men more risk about hypertension, usually low 25 years old. Usually men consume about alcohol, smoking, yeah, and if activity, I think is the same men and women. Maybe there. Thank you.
Thank you, Ms. Magdalena. Ms. Anjar, does it answer your question?
Thank you.
Okay, thank you. Okay, we still have another on-site participant. I think the student behind. Okay, please. Please stand up and mention your name and your institution and to whom your question directed to.
Thank you for the opportunity. My name is Irsyad Tusari from Banjarmasin Polytechnic. My question is, what are your views on how poverty and lack of education become problems to help developing countries? Meanwhile, we have phone now that can access everything. Seek for health information. There are Google's, YouTube applications that guided by doctors directly, and many of them. And I'm sure how poverty they are, at least they have phone on this era. Please give us your opinion about this. Thank you.
Okay, the question is for Dr. Magdalena again. Please, Dr. Magdalena, to elaborate the question.
Okay, thank you, Ms. Evi. Thank you for your question. I appreciate your inquiry. It is the great question coming from the Isyadatu Sari. Okay. Nowadays, the majority of teenagers and younger generation own mobile phone, and it's been a must-have high. The teenager be it the find information from the internet, communicate with their friend, or just to have pression in the social media. Today, people, especially younger, one will be regarded as loser and unscented, why almost every teenager own mobile phone. Mobile phone is one of the used technology to use the communication. As the time passes, mobile phone has grown in functions at high internet speed mode, high depth camera, which allow the connect with many people around the world in the real time. However, mobile phone has its benefit and drawback, especially from financial and social aspect, and the younger preparation in the school. So when the question arises why there is still many ignorance toward health, even though they can access many information. But the answer the question simple, as lately most of the teenager are more fun and simple, as lately most of the teenager more fond of playing games like TikTok and scrolling Instagram or other entertainment rather than researching or reading about the health illiteracy. For instance, when we want to download or open some free application, especially we offer find some ad uploading out everywhere, an opportunity those at promotion of game and other entertainment aspect. This is why I will need an allotted time to specially read to find information about health. Therefore, most of teenagers are less likely to be exposed to health literacy information. In bahasa, I think it's if you want to, jika kamu ingin mencari informasi atau ingin mendownload apapun dari aplikasi, biasanya yang muncul kan iklan, iklan gitu ya. Kemudian entertain. Tidak pernah saat mendownload yang keluar informasi kesehatan. Nah, mungkin itu juga yang menyebabkan remaja dia miskin, punya HP, tapi tidak mendapatkan informasi tentang kesehatan. Itu bisa salah satu penyebab kenapa remaja yang miskin tapi punya HP, tapi informasi tentang kesehatan dia kurang. Karena HP yang dia punya itu digunakan untuk hal-hal yang lain, ya, yang tidak tentang informasi kesehatan. Mungkin seperti itu barangkali. Oke, maybe there are some answer. Thank you.
Okay, thank you, Dr. Magdalena. Miss Irsa, Irsa. I call you Irsa. Is Irsa, does it answer your question? Thank you. Okay. So another question. Okay, just one question, yeah. Is constraint? Maybe your name and your question directed to.
Good afternoon, everyone. My name is
Afternoon.
My name is Lairani Zaputri. I'm from Polytechnic of Health Ministry of Health Banjarmasin. So, in Indonesia, the increase in vehicle use as well as smoke cannot be avoided. Like, I would like to ask a question for Ms. Retno. Like you and Ms. Janice have said, the more exposed you are, the more risk you have. And constantly inhaling vehicle smoke will cause chronic respiratory disease. So my question is, how do we overcome this situation when nowadays almost everyone uses vehicle because it is not only dangerous for human but also for the earth? Thank you.
Okay, please, Ms. Retno.
Okay, thank you for the questions. To be honest, it's a really difficult to overcome if it is in Indonesia. I'm so sorry, but as you can see, if you go probably abroad, just go to another country, we as a pedestrian, we have the same rights as the other people who drive a car. We have a good walking stone just beside the road, and another things we have like a good transportations. Probably if it is in Jakarta, they already have like MRT, so people uh, changing or shift like from driving his own car and changes to use the transportations, the public transportations, because the public transportations is really actually fast. There's no traffic jam, and it's already have a good facilities. But on the other place probably untuk ya mungkin saya campur ya dengan bahasa untuk kita berjalan aja kadang kita masih kalah dengan orang yang berjualan dan yang dan terlalu berpikiran karena di sini mudah untuk driving your own motorbike is very easy. Jadi sangat mudah, mau kemana-mana aja, mau ke warung depan aja, kayaknya mau jalan itu berat gitu kan. Jadi mending naik motor aja, cepet gitu. Nah itulah hal yang mungkin harus kita rubah. And how to overcome is by giving a massive educations. That's like just educate your family, educate your friends, or just like your circle, the importance of physical activity because it's really related to the physical activity, right? So we give like help, we increase the health promotions about the benefit of the physical activity. Or probably, but it is the policy level, just increase the tax of having a car. It's probably the government's already done it. If you have like a 2 cars or 3 cars, your taxes is increased, is getting higher for the second or the third car, but not for the motorcycle. So if one person have 10 motorcycle, it's just the same for the tax. Not but it's not applied for the car. But if you get 10, the 10 car will very pricey, it's very expensive to pay for the tax. Probably it's like one policy that government already done it for us related to about the car regulations things, and the other things is to make the more public transportations. It's really easy to get. Just for example, in Palangkaraya, itu sangat susah ya untuk public transportations. Karena kadang satu tempat sama satu tempat tuh hanya jalurnya ya itu aja. On the other hand, I really want to go to some place there's no public transportations. So that's why I use my own motorbike or my own car. Dan kalau mau jalan, itu tadi. Dan it's really related to the climate change. Oh, it's too hot. Jadi untuk jalan itu juga kayak it's too important to do that. So probably it's our from ourselves and then educate the beneficial of doing the physical activity by reducing doing the motorcycle. And as a result, we hopefully decrease the pollutions, the air pollutions. Probably it may answer your questions. Thank you.
Okay, Lira, does it mean answer your question? Yeah. Okay, thank you. Okay, for on-site participant, maybe I have to close because I have maybe 2 questions from online participant too. That is from Putri. Putri from Poltekkes Banjarmasin. She asking about like that. For tobacco use, what do you think about electronic cigarettes or shisha? Can this replace tobacco or cigarettes? And what should be regulation regarding vape, which is widely used in the big cities? This question for Retno. Ms. Retno, please.
Thank you. It's quite interesting because it's really like a trend nowadays in cities. For the young adolescents, they already use electronic cigarettes. And actually, cigarettes and electronic cigarettes is as dangerous as the other things. I mean, it's the same. The electronic cigarettes and the cigarettes give you the same effect, the bad effect on your health. Probably the electronic cigarettes, it's the nicotine level is probably is a little bit decrease than the normal cigarettes because karena itu kan chemicalnya kan kita racik gitu kalau kayak pakai vape gitu. Nah itulah yang mungkin di manufacturer they can control how percent of the nicotine, but you also need to be concerned about the other chemical things that contained in the vape liquid that also have the bad impact on your health, like acetaldehyde or formaldehyde or the other things. It also can cause risk of the lung cancer. It's not all about the nicotine alone, but also the other chemicals it gives you also like the impact on your health, and resulting you're getting the high risk of NCDs. And for the regulatory, I'm afraid that I can't explain more about the regulations, what the government has done about the electronic cigarettes, but I believe the government already discussed about the regulations of the electronic cigarettes because there are a strong evidence that they give it's not a good impact on your health. Then probably if I may suggest, just like the previous speaker said, that probably we can increase the tax, and it also diberlakukan juga itu kepada vape juga gitu. Sehingga untuk yang anak-anak muda yang probably they get their money from their parents, they still like think twice to buy the vape or the cigarettes. Okay, probably it's to answer the question. Hopefully, yeah, it's answered the questions. Thank you.
Okay, I hope Putri, this is answer your question. Okay, maybe this is that's one excellent point by Dr. Magdalena and Ms. Retno Ayuhapsari. Hopefully the answer are satisfactory, and I'm sure there are still many questions over there. But now, however, due to time constraint, we will have to the end the answer session here. We have come to the end of the third presentation session. We would like to extend our humble gratitude to our speaker, Ms. Retno Ayuhapsari and Dr. Magdalena for their informative and interesting presentation, and also to all the participants for their active participation. Please give big applause for the speakers and for you all. Thank you. So see you all later, and thank you very much. Miss Maggie Kai, now is your turn.
Thank you, Nurse Evi Marlinda, for bringing us to a very productive session. Ladies and gentlemen, I hope you found this session is enlightening and invigorating. And we extend our gratitude to esteemed speakers, Dr. Magdalena SPD MKes and Mrs. Retno Ayuhapsari SKZM Clean Nutrition, for your invaluable contribution to our session. As our token I appreciate towards esteemed speakers, we would like to present the certificate. For the speakers, we kindly ask you to remain on the stage. We would like also to take this chance to give thanks to our moderators for today's seminar. So, to our moderator, Nurse Ruth Mauli Hutagawal MKep, Mrs. Tini Elin Herlina SS MM, and Nurse Evi Marlinda, to please take the stage. To present the certificate to our esteemed speakers and valuable moderators, we'd like to invite Mrs. Anjar Novia Tindingsi SKM MKes, the Head of Academic Administration of Health Polytechnic of Ministry of Health Banjarmasin, on behalf of our Director. To Mrs. Anjar Novia, please kindly take the stage. Thank you, Ms. Anjar, esteemed speakers, moderators. Please take the certificate. For the comedy, we will take the photo, please. For the documentation for this moment. The speakers. Thank you to Mrs. Anjar Novia, esteemed speakers and moderator. Ms. Anjar, please stay on the stage. We will take a few photos more. Now we will take. Please for the committee to help us to take a photo of our moderators and our speakers. Please. Okay, thank you so much for Mrs. Anjar Novia and our esteemed speaker and our valuable moderators who are due to kindly return to your seat in the audience. Thank you.
Hidupku tanpa dirimu, apakah di sana
For our participant, if you might want to see the topic from our speakers, you can see from the barcode that we show on the screen. Thank you. Ladies and gentlemen, we have come to the end of our conference. I'd like to express our sincere I'd like to extend a special thank you to our esteemed speakers and keynote speaker for your insight have truly enriched. We look forward to future engagement and interaction and hope for continued collaboration and share insight in the future. A huge appreciation moderators, sponsors, and organizers whose dedicated and expertise have been pivotal in making this conference a resounding success. In closing, I invite you to continue to pursuit of excellence collaboration. We wish you a safe trip back home and enjoy the rest of your days in this city. I am Maggie Guy, as Master of the Ceremony, signing off. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh. For our participant, you can enjoy the meal of our lunch in the back of this ballroom. Thank you. Ladies and gentlemen, for the IT team, maybe you can play the happy birthday song to our head of this seminar, Mrs. Leka. Happy birthday to you, Mrs. Leka.
Hari ini hari yang tak tahu bertambah 1 tahun usiamu bahagia kamu yang ku beri